Namaskar. We would like to welcome you all on our 440th milestone of experts brainstorming, new generations, experience sharing, and new concept communication. I would like to welcome respected Vishnu Prasad Sharma ji, respected V.K. Agnihotri sir, respected Madam Parul Joshi ji, Principal Shri Balahanuman, Ayurvedic College, Dr. Baljot Kaur, welcome. Dr. Sudhakar Reddy ji, Professor and Head of the Department, Mysore, welcome sir. Dr. Surabhi Datta, welcome. And our beloved Dr. Jagdishwar Doma for Telang Mehboob Nagar, welcome. So without wasting much time, today's subject is Geriatric Care by AYUSH. Today is Senior Citizens Day. We are waiting for Swagath. If he is also there, he will be joining soon. And really, I am grateful. Dr. C.K. Katiyar, sir. Welcome, sir, Dr. C.K. Katiyar. Generally, he does not, but today we are fortunate that we are having him. And we all, approximately us, are of senior citizen category. So please, I am requesting to bless us with your opinion. This will be live on YouTube and absolutely recorded and can be circulated for later viewing. Respected Vishnu Prasad Sharma ji, President Vishwa Ayurveda Parishad Assam, and ex-principal Government Ayurveda College Guwahati. Welcome.
Okay. Thank you. Namaskar. Good evening to everybody. Respected Dr. C.K. Katiyar, respected Professor V.K. Agnihotri ji, respected Dr. Pawan Kumar Sharma ji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all the guests, eminent speaker, to this evening webinar on geriatric care by AYUSH. We have eminent speaker, Baljot Parul A. Joshi, Principal and Superintendent from GANDHINAGAR. I welcome you, Madam. Dr. Swagath N, Professor and Head of the Department of Kayachikitsa, SRS Ayurvedic Medical College, AGRA. I welcome you, sir. Next, Baljot Kaur, Professor, Department of Prasuti, Tantra and Stri Roga. Shaheed, Kartar, Singh, Sarabha, Ayurvedic Medical College, LUDHIANA. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this important evening webinar on geriatric care by AYUSH. I welcome once again all of you. Namaskar. Namaskar. Over to Pawanji.
Thank you, sir. Thank you very much. Now I would like to request Dr. C.K. Katiyar ji for his initial blessings. Welcome, sir.
Yeah, Dr. Pawanji, thank you very much for giving opportunity. I appreciate your continued efforts of having 440th webinar today. The topic is very appropriate, and as you rightly said, most of us are now senior citizens. So today I am participating more as a learner, as a listener, to know more, because we read it some 45 years ago. So I just want to learn more from the teachers. So today I am here as a student, and I think I'll be getting more knowledge and will be more enlightened. Thanks for providing the opportunity for enlightenment. Thank you.
Thank you, sir. Thank you very much. Now I would like to request Dr. Parul Joshi. Where the Parul Joshi? Welcome, madam. Where the Parul ji? Are we audible to you?
Yes, sir.
Welcome, welcome, welcome.
I'm linking my. Is the screen visible, sir? Is the screen visible, sir?
No. Not. अभी तक विजिबल नहीं है मैडम.
So I'm sending it to you so that you can open it.
हैं?
I'm sending it to you, sir, so that you can share it and we don't waste time, sir.
Okay, okay. Then also try. Has sent to me on WhatsApp itself. I can share it to the mail.
Okay, sir ji. Is it visible, sir? Is it
Yes,
visible, sir?
yes. Excellent, madam. Yes, kindly proceed.
So geriatric treatment, because I am an Ayurveda Acharya, I would like to talk on geriatric treatment and understanding and implementing the treatment as per Ayurveda. In the first slide itself, I have tried to show that there is a market called Geriatric Care Services Market. And that market has made a target of US $709 million. The geriatric persons of old age, need special cares. And those cares are in the field of lifestyle diseases, non-communicable, hormonal issues, nutritional deficiencies, and even malignancies, infections, fragility, senescence, osteoporosis, vascular problems. They need a full-fledged system which has a basis of being geriatric friendly. So it starts from leadership, governance, human resources, geriatric care delivery, financing, commodities and equipments needed for care, health management information system. And this is going to cost US $25.7 billion, not million, billion. The Canadian Geriatric Society, which has already started functioning, has its own logo, and they say 5 M's are needed. Matters most important: mind, mobility, medications, multi-complexity. What is shown in the photographs, all the 6 of them, is this geriatric care. Doctor is always needed. an old person is shown like this, sad and in bed and having IV drip and needs oxygen, needs consolation, needs extra care, nursing care, or is put in an old age home and has to manage staying there with all the difficulties because it's not their own home they had made for themselves. The birds are out of their nest, just fumbling to live. Is this geriatric care? They say comprehensive geriatric assessment toolkit, and they assess a person, old age person. And the old age person goes for screening, gets assessed, placement, facility, and transition home. There is no real home in the picture anywhere. These books don't talk that much on the real geriatric care, what an old person really needs. But our S. Suresh Babu has tried to talk on geriatrics in Ayurveda. They say there are three types of cares of a geriatric person, that is old age person: primary care, emergency care, surgical care. It goes according to patient population, goal of frailty identification, potential benefit, main barriers to implementation of the government schemes. There is geographical gerontology, human geography, social gerontology, and the whole thing combined is geographies of aging. A person needs identity, needs emotions, embodiment, health and well-being, aging in place, living arrangements. The main problem is urban planning and urban movement and migration. The final word which the Western society wants to talk on is demographic aging. There's a difference between geriatrics and gerontology. Geriatrics is a branch of medicine that specifically focuses on the health and care of elderly people, while gerontology is the multidisciplinary study of old age and the process of aging. Geriatrics focuses on the medical aspects of aging. Gerontology is the multidisciplinary study of this passing from young age or middle age to old age. So as we see, a child develops into a young person, middle-aged person, and then the graph goes down and old age comes. So this whole procedure has relations with gerontology. The word gerontology was coined in 1903 from Greek words geron and logia. So this study of aging processes coincides with our Shiryate Anena iti Shariraha definition of a human body. Application of this knowledge to future policies and programs will be needed. This is a main concern or substances like opioids, heroin, marijuana, cocaine. Why do they do it? Why do old age people turn on this? Instead of leaving it, they turn over it due to pain, due to distress, due to frustration, loneliness. And then what happens because of this? They face accidents. Those accidents may be in the form of falls or motor vehicle crashes or just going into, what do you say, याद नहीं रहता है, कहीं पे भी चले जाते हैं. They sleep anywhere. So that creates a big social disturbance. Does Ayurveda talk of geriatrics? The Shastra that says that Manushya Purna Ayu is 100 years. Death before 100 years is a Kala Purva or Akala Mrityu. Yes, it does say, speak on it. The 8 Anga of Ayurveda, Kaya, Bala, Graha, Urdvanga, Shalya, Damshtra, Jara, Vrushan. So Kayachikitsa is geriatrics. Is an inevitable disease. Like Mrityu, Jara is an inevitable disease and a step towards death. It can be delayed by timely and proper Rasayan therapy, but Rasayan therapy has its own principles. Purve Vaisi Madhyeva, and that too Jitatmanaha. Rasayan done during Purvavaya or Madhyavaya can only give the desired results in old age, not taken during old age. During old age, a Rasayan can only just give a supportive therapy. It cannot delay old age. So here I have put that Kali Yuga age is 100 years. Sum total of all that changes that occur in a living being with passage of time and deal to decreasing ability to survive stress, functional impairment, and death is what is called aging. The Sampurnata, or having all the dhatus mature, that age is 30 years. After that, after Sampurnata, the decline starts. If proper medicines, proper lifestyle rules are followed, then we are able to delay the decline in health status up to 60 years. After 60, it starts declining. But can we delay beyond 60? Delay in what? Delay in nerve condition velocity, resting metabolic rate, cell water content, cardiac output, glomerular rate, vital capacity of lungs, renal plasma flow, maximum voluntary ventilation. Can we delay all this? Yes, we can delay. Charak, Maharshi Charak has talked in 3 Marmiya Adhyaya, and if we follow those principles, we are able to support the body and eliminate, or at least put aside for some time, these 8 points. The 9th point has to be taken care that estimated 30 brain cells die every minute after the age of 60 years. So for that, since childhood, to be clear or frank, since birth, we have the habit of putting oil at Brahma Randra, Shiva Randra. So that putting oil greases the cells, gives them longevity, they can live longer. And so this 30 brain cells dying every minute can be put to one side, and people even at the age of 98, 99, talking fluently, unstoppably, they don't forget words, they are able to select the proper words and speak in the proper sequence. So that shows that brain stems can be preserved for a time we want them to be preserved. So that again comes to how we have managed our own lifestyle from that day we have started handling our body. So desire for youth, urge to live, distaste for old age, fear of death is inbuilt in all human beings, and geriatrics or Kayachikitsa is related with them. Here we can see that the modern science or the Western world countries are talking that the entire population aged 65 years and over will increase from 6% to 9% in 2019, and that population will further increase by 16%. So from 6% to 16% increase will be there by 2050. That is, 1 in 6 people in the world will be aged 65 years or over. So if we calculate the age being 100 years, every 6% will be old person, and the other 5, including children, have to take care of them. So that is going to be a major world problem according to United Nations. But I am worried about my own country. Today, India is the youngest country in the world. So in 2050, India is also going to face this problem, and probably in a worse scenario. So here we can see that the health theme in geriatrics, the morbidity, mortality, musculoskeletal disorders, common musculoskeletal disorders found: osteoarthritis, rheumatoid arthritis, spondylitis, osteoporosis, back pain, etc. This one research paper, I just liked it, and that's why I put over here. It says that 3 factors that affect the lifespan are heredity, diet, and ionizing radiation. Ayurveda has focused branch of medicine called Rasayana. Kayachikitsa is a method to control or slow down or arrest the aging process. Here, Abhyanga, the Purva Karma of Panchakarma, is supposed to help a lot. Abhyangam acharet nityam sa jara shrama vataha. In this slide, we saw that all these diseases are vata related. The aging has relation with the vata dosha. So, if we go for Abhyanga, the vata dosha does not get vitiated, and so the aging changes can be postponed. How does a person do self-massage? So there's a figure there, how one person can self-massage oneself and keep vata in control. Single rasayana drugs for certain conditions like diseases of eye, diseases of heart, skin diseases, rasayan for overall health, asthma, arthritis, diabetes, neuro disorders, lipid disorders, hypertension, brain and memory losses. But the hidden word is that all these drugs, single drugs or combinations, can help only when the person is able to digest them and is taking these drugs with faith. If these 2 points are neglected, the drug is as good as not taken, or sometimes it may even disturb the person. The types of rasayana are just Vatatapika and Kuti Praveshika. All these rasayanas give result only when they are used with principles, that is called acharasayana. If acharasayana is not followed, then these rasayana, even Kuti Praveshika, is also not going to give result. You can see the old woman, she's smiling. Her eyes are able to see the photographer. What I want is an old age. You can see the couple, they are enjoying the laptop, means they have been able to cope up with the present mechanics also. So I am talking about such an old age where a person is able to utilize his or her experiences in making the world more comfortable or more healthy for the next generation. So reasons for increase of sleep disorders in old age This is a slide which I liked, and that's why I put over here. Sleep disorders are seen in even youngsters or even school-going children, but their problems are different from old age problems. In old age people, there is increase in age-related diseases. These diseases create some problems in the body and mind, and because of them, the person feels discomfortable, and because of that, the person feels sleepless. The drugs, the frequency of change of drugs and multiple drugs, they have their own effects. So without understanding, people give Shatavari Ashwagandha together to a male person. Now the person in is old age, you are giving him Shatavari, Ashwagandha and all that, these Baljot drugs, they have their side effects also. The old person is going to have sleep disorder instead of going to sleep. So we need to say which drug we are giving, to whom we are giving, to which type of habit the person is having, which type of occupation the person had, and then we need to choose the rasayan he or she will need. So if in a person who has a history of cancer, you are saying that I want to prevent you from cancer, so I'm going to give you all these anti-cancer drugs. The person will start thinking of cancer, and even with those anti-cancer drugs, he or she may precipitate into any cancer. So instead of giving such psychotherapies to them, we need to talk healthily to them, extract their histories very nicely, quietly, and efficiently. So that is what is need of the hour. Further age-related aspects such as disorientation of occupational activity, changes in circadian rhythm, physiological changes. These physiological changes have a big role when lifestyles are changed. For example, in person who have retired from a hectic life, and that retirement and that post-retirement, they either go into diabetes mellitus or hypertension. So the family members think that we are taking so much care of the person, and post-retirement, the person is having hypertension. How is that possible? So that hypertension is related with lack of occupation of mind and body. Their cycle has been disturbed. So I always told my patients who were retiring that please see that if your time is from 9 to 4, you please find some way of remaining in your office dress from 9 to 4. So whoever could do it didn't have any problems. One of my directors, he was with Information Bureau. He retired, and post-retirement, he was again brought to job. So he said, Parul Ben, I'm so happy I'm again in job. So the first question I asked, I didn't congratulate him. I asked, Sirji, for how many months? He said, is वक्त तो 12 महीने है, फिर देखेंगे आगे. No, after 12 months, he will be in a pool of troubles. Instead of that, he takes a table, chair in his own house, puts on his office dress, and since he was with the information people, he could start writing some book or collect some things, or that way he could come down from 9 to 4 to 9:30. 9 to 3:30, then 9 to 3, then 9:30 to 3:30. Like that, he can reduce his time and come down to normalcy. And that will help such people come to normalcy and not face any old age problems. See here, I'm very much wanted to share this chart. The Rasayan age, the desired effect, and suitable Rasayan drug. So from the day the child gets birth, Suvarnaparashan is given, and that is even post-death. When we are doing the last rituals, at that time also we are supposed to put a piece of gold in the person's mouth. So from birth to death, even post-death, Suvarna has to be given, and that is Suvarnaparashanam helps in whole body, mind, psych effects. So it's a complete rasayan. Even then, those who want to go for only herbal medicines, they can use Vacha, Ashwagandha, Bala, Amala, Kiloho, etc. And you can see from the age decade 1 to 10, Balya, 11 to 20, Vriddhi, 21 to 30, Chavi, that is beauty. Actually, even if you don't try for beauty, nature is going to beautify the person for its own causes. So 21 to 40 age group, beauty, person should not run after beauty treatments. Nature itself gives the beauty. From 31 to 40, you see Medha. So, Purve Vaisi, Madhyeva. Madhyeva comes. So from 31 to 40, if you concentrate on the Medha Shakti of the person with Shankpushpi, Jyotishmati, or even Vacha, or even Jatamansi, their aging changes can be reduced and no other side effects like brain cells damage and all that can be seen even at the age of 98, 99 or 100. Like Kika Shastri ji, at the age of 100 and 101, he used to write books and he used to speak fluently in Sanskrit. He used to communicate so fluently, I've heard him. So that is possible, provided we target the Medha in the age group 30 plus. So 32 till the person is alive. So that is needed. And see, in the modern world, 91 to 100, karmendriya effect, locomotion gets restricted, and that's why we need to concentrate on them. Steps to prepare for a disease-free old age start from Balyakala. So during Balyakala, the child is dependent, but the parents need to take care in Navjata, say Jata Matra and Navjat combined. Bal Parichirya, Kumara Parichirya, Suvarna Prashan, Shaucha Palan, Devatarchan. The child is taught Devatarchan, that faith that the Almighty is with me, helps in many, many ways. Then comes Brahmacharya, Ashram Pravesha, Vidyarambha Sanskara, and Gurukula Gamanam. Then Gurukula are again coming back. We need to talk on them also. The Gurukula life is something like our present hostel life. Yuvavastha, Madhyamavastha, and Parihani Avastha is all what we see at present, and we have been talking about this many times. Vruddhavastha, that is Sannyasa Pravesha, Alpalpa Samajik Karya Kartavya, that is what is necessary. Ishta Smaranam, Tirtha Gamanam, Tirtha Aradhanam, Adi Kartavya. Swa Parivara, Swasthya Rakshartha Prayatnam. So during 75 or 80 plus age group, they need to take care of their own family also. Telling the youngsters, take care of the child in this way, keep the child near to them so that the child is not disturbed by other forces. Mano nigraha, dhyana adi kartavya. So when the elder in the family are doing all this, the youngsters, especially the children, are going to learn that, and they will not be able to have any other problems since they have understood this from their right age of childhood. Manoswasthya suraksha. Whatever happens, their position, mental position should not change. Mrityusya sajjikaranam. Prepare for death. Actually, since the day we got born, our death time and place were determined. But since we have Maya around us, we forget it and we do all sorts of follies. So this Yuvavastha, Madhyamavastha, Parihani Avastha, and all those principles need to be kept in mind and followed so that Mrityusya Sajjikaranam comes very healthily. Care of elderly, that what we have seen ahead is again I have put over here. There is a national policy in India for senior citizens from 2011. Atal Pension Scheme, PMY Vandana Pension, Old Age Pension, irrespective of disabilities, and all those things they have brought. The government is trying their level best, but we also need to create awareness about the necessities of the old people, medical and socio-economical problems, and help them get healthy aging. Geriatric care services market 21 to 2028 is put on the net. Market size 5.3%. It will increase. Which are the target countries? The key players in the market. It's really funny. They're trying to make money from this. This is a clipping from a paper saying how India is not taking care of their old family. Families taking care of their servants when they grow old. They are called either kaka or dada, masa. They are given so much care. They are, even the old people in the family, the elders in the family, take care of them as their own brother or sister. I've seen it. So this is media talking all nonsense. Now, coming to India again, this is Adya Guru, Ajar Amar, Adya Guru, Mahadeva. All these poses of Mahadeva. He is a drug addict. He's so angry. He's always carrying that Trishul, Nataraj and all that. No one talks about him being Ardhanarishwar. Being so calm and quiet and always thinking of good for others. That is Acharya Rasayan. He is a man of principles. People have made him a god. He is a person, a live entity. We can feel him, we can see him, we can hear him if we have faith in him. So since it is a Shravan Masa, I need to talk of Adya Guru. Since the Natha Sampradaya is a part of Ayush, so he needs to be talked of first. Then comes Indra, a Swargadipati. He is king of Megha, that is clouds. Saudamini, that is lightning. He is a mighty warrior. What is shown on the television and everywhere, in the media and everywhere, is he is a very egoistic person. He commits so many follies. He rapes ladies, especially Rishi Patni. It's not so. He is a very courageous man. He is actually the last divine Ayurveda Acharya who transmitted the divine knowledge to humans, and that was Rishi Bharadwaja, the person who used to go intergalaxial. Now, Ajar Amar Shiva Shankar. Ajar, there is no old age. Amar, there is no death. No one knows when he got born, and no one knows his own age. He's there. He's still functioning as he did on the very first day he put himself before the globe. Indra is still there. This may be probably the 12th Indra because they change according to the time. So this is probably the 12th Indra, but our galaxy is crores of years old. So his life is quite long. And Maharshi Charaka has talked of Indra Rasayan. And that is the Rasayan which Maharshi Bharadwaja took, Indra Rasayan. Maharshi Bharadwaj, being Shishya of Indra, used to consult him for his own problems. And he, with his 55 disciples, went everywhere and propagated Rasayan therapy. He was the person who meditated upon Shiva Parvati for Vedic knowledge. He and his students wrote Ruchas in the first book, that is Rigveda. He was amongst the Saptarshis, initial Saptarshis. He was the first-hand witness to Crouch Bird's incidents of Maharishi Valmiki, who uttered his first shloka of Ramayana, seeing those death of those croucher birds. And Maharshi had seen that incidents happening. He was an egoless. He spent part of his life spreading Vedic knowledge as per command of his guru. Dronacharya of Mahabharata was his son. So, Rishi Bharadwaja lived quite long. It is said he lived for 800 years, had 30 children, but he never mentions them. He mentions his students as his sons. This is Indian family. At present also, the father, grandfather, child, 3 generations here and 4 generations in the bigger picture. Grandmother playing with the granddaughter, granddaughter learning from the grandmother. This is present Indian scene. They utilize common kitchen, spend common purse, contributed by all. And they live happily with all their problems. They are together. And that togetherness is the need of the hour for all, for those siblings and those old age people. Together, they all survive. You can see in the bigger picture that the old person is not able to remember many things. That's why he's sitting like this. But the younger generation is taking care of him. In MDH Masala, that person, that old person, proprietor of MDH Masala, during his last time, the whole family was around him. And since he liked patriotic songs, they were singing those patriotic songs he liked around him. And someone was taking the video of it and they had put it on the YouTube, that he smiled when he left his body. So that is India, the India we live in. Thank you. Thank you, everybody.
Your screen is off, Parul ji.
I finished, Sarji.
Do you like to say something additional? No.
Okay.
Hari Om.
Yes, yes. Am I audible?
Yes.
Yes, sir. So Rasayan therapy done from the day the child is born helps prevent or prolong old age. And even when the old age is achieved, the person does not face the problems talked of. For example, neurotic symptoms or related with the bones, related with the musculoskeletal system, or even brainstem. Those emotional problems will not be seen, and the person passes into a healthy old age, enjoys the old age, and the family also benefits from the person. So that is the old age talked of in Ayurveda, a part of Ayush family.
Thank you. Thank you, madam. Thank you very much. Now I would like to request Dr. Baljot. Welcome, madam. Welcome.
Thank you, sir.
अग्निहोत्री जी से रिक्वेस्ट करूंगा आगे के मॉडरेशन की, मेरी वो कनाडा वाली वेबिनार है 7:30 बजे से।
वर्मा जी का फोन आ रहा था, हम लोग अपनी वेबिनार बिजी थे तो अटेंड नहीं कर पाए, परसों की बात है। अच्छा
Welcome, madam.
Thank you, sir. So shall I start?
यस प्लीज स्टार्ट करिए आप द प्लेटफॉर्म इज योर्स द टाइम इज योर्स
Okay, sir. Thank you. With the blessings of Lord Dhanvantari, I thank Dr. Pawan Sharma, sir, Dr. Prasad Sharma, sir, Professor Vivek Agnihotri, sir, Dr. Madan, sir, and Independent Research Ethics Society for giving me this opportunity to share my views on menopause on this World Senior Citizens Day. Now, my topic is menopause. Like with Ayurveda, it's for me, there is no pause. Just a minute. So, why menopause matters? With the increasing life expectancy, women spend 1/3 of their lifetime under menopausal period. Though menopause is a natural phase of the normal process of aging, it is turning into a major health problem in recent years in the developed as well as the developing countries, mainly due to lifestyle changes. It is therefore important to address menopause-related diseases and role of Ayurveda from the preventive and curative aspect. So what is menopause? WHO has suggested that the definition of menopause as the permanent cessation of menstruation resulting from the loss of ovarian follicular activity. The diagnosis of menopause is retrospective following a period of amenorrhea of 12 months. Now, the average age of menopause is usually around 50 years with limits between 45 and 55 years. Now, these are the stages of menopause. So first is the premenopause, no menopausal symptoms and still have periods. Then is perimenopause. It means around or near menopause, symptoms of hormonal changes, can still become pregnant, usually lasts about 4 years. So this is the start of the menopausal changes, and this period is very crucial because periods are regular, ovulation still occurs, so there are chances that a woman can become pregnant. So what happens is periods become late. There is a gap of 2 to 3 months to 4 months, and they think like it's a menopause, so their periods are late. But during that time, they become pregnant. So I advise all females in this age group that if you skip your periods, if they become late, you just check for the pregnancy because this usually happens. And there are many menopausal changes, which we will discuss later on. Then menopause, there is no period for 12 consecutive months. Ovaries stop producing eggs and average age is 51. And post-menopause, over 1 year since last period, will remain in this stage for rest of life. Now, Rajonivritti. Now, Rajonivritti or menopause is not described as a disease entity in Ayurveda. It is considered as a normal physiology which occurs due to aging. The age of Rajonivritti is mentioned as 50 years. Jara Pakva Shariranam Yati Panchashat Kshayam. This is the probable age. Rajonivritti is made up of Raja and Nivritti, where Raja means Artha and Stri Push, that is menstrual blood and ovum. And Nivritti means end or cessation. Therefore, Rajonivritti can be defined as Rajo Stri Pushpasya Nivritti Asya, that is cessation of menstruation and ovulation. So then Jara, that is the old age, and Rajonivritti are manifested due to progressive reduction in the function of Agni, that is metabolism. During the period of Rajonivritti, there is increase in Vata and Pitta dosh and decrease in Kapha dosh. And here I would like to mention that the middle age is Pitta predominant stage, and the menopausal age is Vata predominant. So during perimenopause, it is the transition phase. So we find the symptoms of Vata and Pitta dominance mostly, and Kapha dosh dominance in comparatively less than them. So there is decline in nourishment and function of all dhatus of the body, especially Ras dhatu. So symptoms of menopausal syndrome. So this is in general common symptoms, and it's said that itchy, they're itching, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. So the main changes can be described under 3 headings. Disturbance in menstrual pattern, symptoms with acute onset, and symptoms with late onset. And the disturbance in menstrual pattern, it is like either the menses become scanty, duration is increased, or heavy bleeding. And usually females have this bad thinking that heavy menses are okay, they should be there, and it indicates that they are nearing menopause. So it should not be there. It should be females should be educated about the normal menstrual pattern. Now, symptoms with acute onset, these are vasomotor mainly, that is hot flushes, night sweat, palpitation, headache, etc. Now, hot flushes, they vary in number from 1 to 2 in 24 hours to 1 in every 15 to 30 minutes, and is often associated with profuse sweating. They occur by night as well as by day, and sleep is disturbed by night sweat, which leave women bathed in perspiration. Vasodilatation is followed by vasoconstriction. So after a flush comes a shiver. Then genital and sexual conditions mainly vaginal dryness, decrease in libido, dyspareunia, prolapse. Urinary mainly incontinence, mainly earth and stress, burning micturition, increased frequency of urine. Gastrointestinal, loss of appetite, bloating, constipation. Then psychological, mainly mood swings, depression, memory impairment, loss of concentration, insomnia, and mainly these psychological symptoms occur. One of the cause is the empty nest syndrome, because by this age, children are grown up, they are settled, and they are in other cities and other places. So they are, mother is usually alone, and we are not empowering women, we are not making them understand that the female should have her own some hobbies or some occupation, so that when she is free from her children, when they are settled, she should have, when she will be having time for herself, she should use it in a positive way. So she will not feel all these symptoms. Now, memory impairment is directly related to hot flushes in women. During a hot flush, blood flow decreases in hippocampus, possibly impairing memory and cognition. So we don't have actually the real main cause for hot flushes, but it is said that the thermoregulator, the thermoregulation in the hypothalamus, it gets disturbed. Alzheimer's disease has been shown to be linked with declining estrogen. During perimenopause, there are intense and regular fluctuations in the levels of estrogen, which tends to decline up to the postmenopause, and this period appears to be associated with a higher risk of depressive symptoms. So we usually find females with all these symptoms. Even I discuss with my students, I tell them that you should observe your mothers, how they are behaving and how their behavior is changing. So you should, being a medical student and being a concerned male member of the family, you should help her understand why these changes are occurring. So when we know that this is the cause, so we can easily have handle this situation. So menopause is a perfectly natural process. As family members and friends recognize that this is a normal process and learn about the normal natural symptoms, they will then treat the woman like she is normal and natural rather than a crazy woman. So there is no more creative force in the world than the menopausal woman with zest. So this is the time when this is your own time. So symptoms with late onset, mainly osteoporosis. It is responsible for greater incidence of fractures of spine, that is 32%, proximal fever 16%, and distal radius 15%. Strength of bone depends on the integrity of collagen matrix. Decrease in collagen matrix can be understood as decrease in kapha, resulting in osteoporosis due to increase in Vata. So Asthi is the main seat of Vata. The increase and decrease of Asthi and Vata are inversely proportional to each other. That is, when Vata increases, Asthi decreases and vice versa. Hence, the factors which cause increase of Vata will cause decrease in Asthi. Now, mainly cardiovascular system, the incidence of coronary artery disease and myocardial infarction in women, which is about a fourth of that in men in premenopausal years, rapidly increases in the postmenopausal years to approximately same as men. Atherogenic lipids are also increased. Total and LDL and or bad cholesterol levels, which are lower in premenopausal women, rise rapidly after menopause. Decline in Ras Dhatu and development of kapha due to increase in Vata causes cardiovascular diseases. So coming to hormone replacement therapy. So mainly is the compliance issues with HRT. Overall compliance with HRT is poor with dropout rates as high as 40 to 60%. The main reasons for discontinuation of HRT are vaginal bleeding, breast tenderness, nausea, vomiting, weight gain, and fear of breast cancer. A study published in Lancet by Tantra et al. In 1998 clearly established that there are no beneficial effects accrued by HRT on cardiovascular disease. So from HRT to hormone therapy, following the abrupt early halt to HRT portion of Women's Health Initiative in July 2003 due to the findings that HRT's risks outweighed its benefits, headlines now read, menopause is not a disease, but a normal part of life. So hormone replacement therapy has become simply hormone therapy in recognition of the fact that replacing estrogen is not natural and brings dangerous side effects rather than the foundation of youth once touted. So coming to the Ayurvedic management, how we will manage menopause with Ayurveda. So mainly since it's a Jara Vyadhi and it's a age related changes, so we Rasayana is indicated for Jaravastha. So what is Rasayan? Rasayan is the process which nourishes the body from properly formed dhatus and increases the vital process and prevents the degenerative process. So Rasayan is one which leads to continuous nourishment of Rasadi dhatus, where we're replenishing them by Acharya Dhallan. Then, according to Acharya Sushrut, Rasayan is Vayasthapak, which retards aging process, that point, or it increases the longevity of life. Then, according to Acharya Charak, Rasayan enhances the Dhi, Dhriti, and Smriti, helps in maintaining Arogya, youthfulness, which enhances Prabha, Varna, etc. So Rasayana, it's antioxidant, adaptogenic. Now aging is due to accumulation of free radicals. Ayurvedic Rasayanas are good antioxidants. They also provide micronutrients in bioavailable form and are capable of strengthening the immune system and maintaining doshas, dhatus, and agni. All the Rasayan herbs have immunomodulatory, phytoestrogenic, and adaptogenic activity. Rasayanas are broadly classified as three types: Achar Rasayan, Ahar Rasayan, and Dravya Rasayan. Now, coming to Achar Rasayan, that is the daily conduct. Now, lifestyle changes with Ayurveda. Achar Rasayan is a unique concept in Ayurveda that implies moral, ethical, and benevolent conduct. It is described detail in Charak Samhita Chikitsa Sthan 1, 4th part, slok number 30 to 35. These behaviors bring about rejuvenation in the body-mind system. One who adopts such conduct gains all benefits of Rasayan therapy without physically consuming any Rasayan medicine. So when we follow these daily routines, Achar Rasayan, most of the time medicine is not required. It is mainly related to lifestyle management. Its two important pillars are Sadvrit, that is good conduct, and Swasthvrit, that is healthy living. Now, Sadvrit, it has been proved that good moral life with hygienic living, such as truth, non-violence, personal and public cleanliness, mental and personal hygiene, devotion, compassion, and yogic lifestyle improves the quality of life. Swasthvrit, this includes regular exercise, hygiene, sleep, and daily activities. Mainly the sedentary lifestyle, cigarette smoking, high intake of salt, consumption of alcohol, aerated drinks, junk food should be avoided. They are associated with a higher incidence of osteoporosis and cardiovascular diseases. Now, for women, the paricharyas to be followed, mainly Rajaswala Paricharya, that is regimen during menstruation, Garbhadhan Vidhi, that is preconception care, Garbhini Paricharya, antenatal care, and Sutika Paricharya, that is postnatal care. These are the preventive aspects. If a woman throughout her life follows these paricharyas, then her menopausal life is very healthy and comfortable. Now, Vyayam or exercise, muscular exercise is important to maintain strength and mineralization of bones. Yoga helps promote better muscle coordination and strength, also improves mental abilities and skills. The saying, move it or lose it, is never more true than after the age of 50. Besides maintaining bone strength, the main goal of exercise is to increase muscle mass in order to improve muscle function and to maintain good balance and strength. Weak muscles and poor balance can contribute to falls and fractures. So yoga, mainly asanas and pranayam, plays a significant role. Then Ahar Rasayan or the diet. Grit Kshiradi Nityasu Mudita Sukapatmasu Artavam Tishtati Chiram Viparitatvakto Anyatha. That is daily intake of ghee, milk, diet which promotes and maintains kapha can delay the onset of menopause. Ghee is a good source of omega-3 fatty acids. It also reduces atherogenic lipids in serum. Sesame seeds or till are good source of zinc and calcium and also have antioxidant property. It is best for balancing Vata and it's said to be good Artavjana. Chickpeas, Bengal gram, black grams are good sources of phytoestrogen. Now, what are phytoestrogens? Phytoestrogens are plant-derived substances whose structure results in a chemical nature similar to endogenous estrogens of humans. They are adaptogens also. Phytoestrogens, also called dietary estrogens, are a diverse group of non-steroidal plant-derived polyphenolic compounds which exhibit structural similarity and mimic the effect of naturally occurring estrogen compounds in the body. Now, how is phytoestrogens work? All hormones act through receptors on the cell surface. Now, estrogen has two receptors. Estrogen receptor alpha is predominant in uterus and pituitary. Estrogen receptor beta is present significantly in ovary, testes, prostate, brain, blood vessels, and bones. Recent reports indicate that phytoestrogens exert their effect in a SERM, that is selective estrogen receptor modulators, like manner. The two-phase action of phytoestrogens, they exhibit estrogenic and anti-estrogenic activities in different target organs. Phytoestrogens preferentially bind estrogen receptor beta, so they act as anti-estrogenic in breast and uterine tissue, but estrogenic in bone, brain, and lipid metabolism. So there are four groups of phytoestrogens: isoflavones, lignans, comestans, and resorcilic acid lactones. The plants rich in lignans and isoflavonoids are soybean, flax seeds, sunflower seeds, poppy seeds, caraway seeds, wheat grain, oatmeal, carrots, garlic, peanuts, black and green tea. Among these, flax seeds are the richest source. There are other food items also which are good source of phytoestrogens. So there is no definite recommendation about the dietary amount needed for prevention of diseases, but these can be taken in small amounts from perimenopausal period. Lignans and isoflavonoids have a significant inhibitory role in cancer development. Vegetarian diet helps in mineralization of bones, whereas the non-vegetarian diet, especially containing red meats, causes demineralization of bones. Now coming to Dravya Rasayan or the treatment. Now, the herbs having Rasayan property are mainly Tinospora cordifolia, Piper longum, Allium sativum, Whitehania somnifera, Comifera mupul, Asparagus resmosa, Puraria tuberosa, Glycyrrhiza glabra, Centellaria asiatica, Ocimum sanctum, etc. Terminalia arjuna is best cardioprotective and cardiotonic. It also provides bioavailable calcium to prevent osteoporosis. It can be given in Kshir Pak also. Now, group of herbs as Rasayan. Dashemani is given in the Charak Samhita. Among them, Vayastapak Gan, Jeevniya Gan, Bruhniya Gan, Sandhaniya Gan, Balya Gan, Shramhar Gan, and Shodhar Gan. The herbs from these ganas can be given during menopause. Now, the Rasayan, the procedures. Panchkarma, the 5 purification measures are advocated for alleviating diseases and maintaining health. Curative treatment advocated especially in diseases during menopause are Abhyang, Basti, Nastya, and Shirodhara. All these 4 procedures, they give wonderful results and elevation of the symptoms. Now, there are various researches on menopause have shown that combinations of herbs and panchakarma elevate the symptoms and improve the quality of life. These are some of the researches I have added. There are many other researches have been done and are still going on. Now, menopause is not an estrogen deficient state. Rather, it is a transition phase in which all the symptoms are affected. So, Ayurveda assists women in the journey towards better quality of physical, mental, emotional, social, and spiritual health in the latter half of their life. So, aging is an extraordinary process where you become the person you always should have been. So, thank you.
Hello, Dr. Paul.
Hello.
Professor Baljot Kaur has completed her presentation. So, thanks, madam. Thank you very much. You covered almost all the sectors related to the ladies reaching to menopause or premenopausal status, including their symptoms, their factors, the etiological factors. And the plus point is this: the topic of your talk itself is very attractive and appealing to hear. That menopause with Ayurveda, it's for me. There is no pause. It appeals like anything, and this is a fact. For ladies, day, night, pre-marriage life, after marriage life, child-bearing life, or even working lady or housewife, whatever it is, the pause is not there in their life.
Yes.
So you very confidently and very intelligently put this word, and I really appreciate that there is no pause. If they will to go for a small pause, that itself either the husband or the children, they will not let them allowed to go enjoy.
So yes, sir, she should maintain her health so that that time is hers only.
Then only she can manage the double duty or 45 duties. So if you say that today I am on leave or I would like to take rest, very politely, very humbly, the husband will say, well, ma'am, let us have a cup of tea among us. I mean that time will also be utilized in a very pleasant manner, but still no pause is still stand still in the same way. So thank you so much. The idea is this, that on the celebration of our world's senior citizen day, it's a very important topic, and it covers the 50% of our whole sector represented as a population. So you very wisely, being a professor of social, this Prasuti Roga, this is the very vital part, and probably most of the ladies, those who are not belonging to medical fraternity and reaching to so many sectors of our fast life, say scenario, they definitely be appreciating on direct hearing from you, or when they will visit the YouTube or they visit the archive. So thank you very much, and I do hope that as usual you had been giving your approach or topic with fullest of your knowledge, and it's a practical aspect. The idea is that practically it is to be known to each and every ladies that how they are going to face the different changes in their body, how they should manage according to the psychological factor is concerned, because on today, the economic crisis factor is not much more, which I am conceding to the say middle class family and above middle class family, because I don't say that lower middle class family sector might have abolished almost. Okay, when the both persons are working, little bit lower middle class sector is gone away. Now they are well managing even their kids, their office, their duties, and their professional life, everything. So thank you very much. Thank you so much. And you put your this ID, I mean the mail ID along with your phone number, because as and when we will also in need of your cooperation, your knowledge sharing, we will be contacting you. So kind of you.
Thank you so
Thank you.
much, sir. My pleasure.
Thank you. And we do remember that we know each other, as I had been visiting Sarabha College twice, thrice, when Dr. Krishna Baldev ji was principal there.
Okay, sir. Okay, so that was
I,
before joining.
yeah, so I had been there.
Okay.
I came for the Swasthya department for
Okay.
practical examination, or sometimes some this guest lecture, etc. So thank you, ma'am. Thank you again. We will
Yeah.
again disturb you whenever
Most
our
welcome, sir.
society will be in need of your
Yes, sir.
cooperation. Thank you, ma'am. Thank you so much.
Yes, sir.
So we have got our today's webinars on completion of our second speaker, and now our third guest speaker is Dr. Swagath ji. I think he has not joined by then. I'm just contacting Dr. Swagath ji. If you have joined, he is not joined by now, I think. Dr. Pawan Sharma ji, are you home? Are you home, Dr. Pawan Sharma ji? Are you hearing me?
No, Dr. Pawan Sharma attending another webinar from.
Yeah. As he informed me, but the idea is that if we are having only two guest speakers today and Dr. Swagath is not joining, then we can go for the discussion as our guest speakers have, address has completed. I think if at all he joins afterwards, then we may take his presentation. So let us start our platform for the discussion on today's World Senior Citizen Day. So as Dr. C.K. Katiyarji introduced and gave his blessings right from the very beginning of this webinar, after the welcome address by Professor Vishnu Prasad Sharma ji from Guwahati. So I would like to take the well wishes from Dr. Ramnathan ji, if he is very much with us in this sequence. Thank you, sir.
Yes. Good evening. Good evening.
Good evening, sir. Good evening.
Very useful webinar. But unfortunately, I not seen the first section. But I go through the madam section.
Yeah.
That is, he is three area. That is Ahara, Ajara, and Divya Rasayana. The three concepts. Definitely, it is very useful for the youngsters, the thinking process and treatment process. Well presentation and all the Ayurvedic aspects and as well as the modern aspect and how to go manage the through Ayurveda. That also she well predicted and well managed the things. Only we want to request to madam, give me some your experience last 10 years or 15 years. What is a menopause season complication and also the management? That is also give me one your experience to share it. It is very useful, madam. That is my. Anyhow, the fantastic presentation, madam. Thank you.
Thank you, sir. Thank you very much for your kind suggestions and viewpoint. It is a fact that they are competent enough to address and justify the viewpoint they raised, and our richness is this, that our both the speakers are our respected ladies. So very naturally, as usual, as far as Dr. Parul Joshi is concerned, she is beyond the limit of the subject. As and when we are in need of her speech, her guidance, her suggestions, she is, we found always that she is ready with the subject matter. And so goes the case with our today's second guest speaker. So as you pointed out that the personal experience, I am in the opinion that if our few discussions are over with our some of the great dignified speakers of our platform, we will take the feedback from both our guest speakers, from Dr. Baljot ma'am, and also from Madam Parul Joshi. And if you are, if Dr. Baljot ji is here to just give some answer and of your query, she is most welcome. So, Madam Baljot ji, if you are here,
Yes,
would
sir.
you like to say something? Yes, please.
Yes, sir.
Namaskar.
Namaskar, sir. So we have very good treatment and management with Ayurveda for menopausal symptoms, be it physical.
Ma'am, just raise your voice volume. Is thoda little bit kam aa
Okay,
raha
sir, just a minute. So now it's okay?
Thank you, ma'am. Thank you. Yeah.
So with Ayurveda, we can manage the physical, mental, emotional complaints of the female. Mainly, many studies have been done throughout India, and mainly being a student of IPGT and RA Damnagar, we know there was menopause clinic was going on now also, and there many studies have been done on Rasayan Kalpvati, and we have got very good results. And with the start of the perimenopause and menopause associated symptoms like joint pain, this hypertension, these all can be managed with these medicines. And along with this, that I have mentioned about the ahar and the diet aspect, that is very much important. From the perimenopause, these jeera, methi, soft, these spices can be made into a powder and can be taken half spoon morning and half spoon in the evening as a maintenance. These also help very much. And studies have been done on Vayasthapagan and the herbs like Shatavari, Bala, Yashti Madhu. They have given wonderful results. And coming to Panchkarma, whenever there is anxiety or the mental aspects, Shirodhara and Nasya, it gives wonderful results. And Nasya we usually give with Mahanarayan tail, or with Kshir Bala tail or Shatabari grit. These can be used. And Shirodhara can be given with Dashmul Kwa or Mahanarayan tail or Sehcharadhi tail, Dashmul tail can be given, and it relieves symptoms wonderfully.
Thank you, madam. Thank you, and I thank both of you, Dr. Ramanathan.
Yes, thank you. Well covered.
Thank you. And that's why I found that if she is just available to the platform, it's better to have the answer, because it's a right time, and it's a direct answer and question both the person.
Usually we are facing the menopause time, that is the constipation, ladies constipation usually. So
Yes,
that area, how can you manage? Usually the constipation, most of the menopause time.
Yeah.
Sir, for this mainly lifestyle, how much movement is there, her sleep pattern, it also affects the bowel movement, and then how much fluids she is taking. As I said that this fennel, cumin, these things can be added, and if she is healthy, then this gulkan can be taken at the night, or otherwise haritaki is very good. So Eran Bhrish Haritaki or Haritaki as such also can be taken. It helps a lot. And along with that, some amount of ghee should be there in her diet.
Thank you, ma'am.
Thank you. Thank you.
This is also a burning question, burning problem to the ladies. And moreover, what I found during my whole of this journey of Ayurvedic and the treatment dealing with the patients, because you see, if a male is with me as a patient, his wife used to be with her, and casually, if at all she is having any problem, she narrates, though I refer to the gynae department, but still sharing is no problem as far as the constipation is concerned or dyspnea is concerned. May she be running through the menopausal changes? That happens. So what I found, it is always a very important factor, that is a psychological factor, like
Yes.
hot flushes, high blood pressure. Then again, the gynecologist they refer to us that this you are going to treat with the Kayachikitsa persons. So in that way, it is a bridging system. So what I feel that as per your suggestion, if the lady is not having any crisis regarding the diabetes concern, this milk with munakka is also
Yes,
of
sir.
great use at bedtime. And again, as for the psychological effect, there must be some soothing effect medicine be easily be given, like ashwagandha or this thing. Because I was having very important point, like say. Sometimes they used to say that hem pushpa or emputone or eve care, something of that sort. But once I found that as far as the jerry food is concerned, that is
Yes, sir.
very useful. And
It is
when
also good result.
and when I Himalayas, when I prescribed jerry food, you see, again that lady came to me. She was running with the 52 to 57 age group. She told that I started having something vertigo or some say sweating along with some perspiration and uneasiness. I found why it is. It is a drug of senior persons. I gone through the ingredients and I found that there is some sort of this makaradhwaj or something. So that may lead to high blood pressure. And again, I gone through the literature of the syrup jerry food that is free from makaradhwaj. And I shifted her from and this jerry food tablet to jerry food syrup, and the results are wonderful. So that's why Dr. Ramanathan ji talking about the experiences. My dear friend, experiences are there also with the male physicians also. We are also having some sort of experiences. So that is a pleasure that being physician, we never discriminate with the gender. Girls, ladies are coming, they also say that my husband have got some problem, he wants to talk to you. Naturally, Swagath Hai. So in that way, things are very good. So your experience will amount to all those beginners and also all those experienced persons, if at all any crises are there, because ladies are always very respected and very polite, delicate, and they have got a lot of burden of the family. So thank you, ma'am. Thank you so much. Our Pawan Shamaj is again with us. Namaskar, Hari Om, sir.
Hari Om, sir, Hari Om.
We have
I have
started
joined in Canadian webinar by Dr. Harish Verma ji.
He was. Yeah. So we have started the discussion, panel discussion program.
Just now it is started. So please take care of open session.
Yes, sure.
Just now it will continue for 1.5 hours. I have shared the link.
He was also phoned me 2 days back, but we were busy in our webinar, so we couldn't respond. And then you see, we are always busy in other works. So thank you very much. We will continue our this platform for our discussion. Okay. Thank you, sir. Okay, sir. Now, I think that I must manage the balance. One invitation from female side, so one invitation from male side, and I am going to take the benefit of it. Professor Anup Gakharji with us. And I would like to take some points from him. And as he joins, we have got Professor Sudhakar Reddy ji. Professor Sudhakar Reddy ji, as you are also a medical couple, so you might be having the same type of experience as a personal experience. So you please join in and share some experiences on today's webinar subject, along with some good wishes to our senior citizens as a remark of the World Senior Citizen Day. Professor Reddy sir, namaskar.
नमस्कार सर.
Namaskar.
नमस्कार सर. कैसे हो सर?
हम
नमस्कार.
ठीक हैं.
Pranams to all dignitaries.
Thank
Thank you
you.
very much for inviting me. And today, World Citizens Day. Happy
Yeah.
Citizens Day, all the citizens of India, all over the world, senior citizens. And two speakers, they have elaborated regarding geriatric problems and their Ayurvedic solutions, etc. There is no much to say, but as concerned to Swastha preventive medicine and Agnihotriji Sadhi will expect from me only Swastha point of view.
Sure,
So,
sure.
We have some methods like prevention of the old age, as per me. Nidana Parivartana. So what are the cause for the Jara? Even though Jara is apya, but we want to prevent some geriatric problems that can be taken early in the age only. That's why Nidana Parivartana, Ahara, Vihara, Rasayana, avoidance of sedentary habits, and excessive intake of Lavana and Chara. Already the direct quotation is there. Diva Sapna, Bahya, Abhaya, Krodha, Love, etc. But if you see as per my knowledge goes, the prevention of the age-old factors or age-old problems can be solved by primordial prevention and primary prevention, secondary prevention, tertiary prevention. I'll just speak about that one. How primordial prevention will be helpful. So primordial prevention means the age-old problems are not occurred. Still, we are taking some measures to prevent that one, like antenatal, Garbhini Paricharya only. During Garbhini Paricharya only, if the Garbhini follows proper Garbhini Paricharya, definitely the dhatus will be normal. It prevents old age factors. And secondly, neonatal. After delivery, neonatal infant children, there's Jata Karma, Swarna Prashana, and Bala Rasayana. If the children gives Jata Karma, Swarna Prashana, Bala Rasayana, etc., definitely they are going to help in prevention of the old age factors. As a primary prevention, Ayurveda mentioned there are so many things are there. For example, Nasya Karma. He says that Jiryatascha Uttamangascha Jara na lavate balam. So if we go for Nasya Karma, example, like Pratimarshana say every day, the Jara Lakshanas can be postponed, and the Uttamanga of the Uttamanga will be more important in old age. So there, all the Uttamanga Vyadis can be prevented by Nasya Karma. So Pratimarsanasya, it can be useful as a primary prevention of the Jara Lakshanas. And Kalityam Pinjaratvancha Keshanam Pratanam Prataha. So Abhyanga, Shiro Abhyanga or any Abhyanga, definitely it helps to prevent the early old age symptoms like Kalitya and Pinjaratvancha. Again, Abhyangam Acharya Nityam Sa Jara Sramavataha. So directly says that if you go for Abhyanga daily, the Nityam Sa Jara. So Jara can be prevented and the problems of the geriatrics can be prevented and by Abhyanga. So there is a primordial prevention. Again, this is that Bhavat Abhyangam Nityam Naro Alpa Jara Evacha. So that means the Jara can be delayed by daily Abhyanga. Again, this is. Again, Nityam Snehada Shirataha Shiraha Shulam Na Jayate Na Kalityam Na Pinjaratvam Na Kesham Prapatacha. So beautifully they explained. If you are applying oil to the head daily, the Kalitya, Palitya can be prevented and also the Jara Lakshanas can be prevented. Again, they says that Na Chaivam Sahasa Karma Jara. So the Sahasa Karma are beyond our capacity. If we are not doing the work, definitely our aging factor can be delayed. So these are the factors mentioned. Others like also mentioned Chatra Dharana, Paduka Dharana, Naka Kartana, Satsu Kartana, Kesha Kartana. In all the things in a sloka, Acharya has mentioned that there is a Jara can be prevented by these all these things. Okay, and taking, as per my knowledge goes, taking one amalaki, like one apple keeps away from doctor, but here one amalaki every day with sugar, honey or ginger can prevent the old age factor. And taking ashwagandha 10 grams along with milk or ghee also prevents the old age factor. Taking triphala with grita and madhu also. And nitya kshira grita abhyasam, that already mentioned Are Rasayana. Daily taking kshira and grita abhyasa definitely delays the old age factors. And as a secondary prevention, if your diseases are eyes, most of the time, and geriatric people maybe having the eye disorders. So there, Jyotishmati, Triphala, Shatavari, Ishtamadu, Amalaki can be taken. And heart diseases like Shalaparni, Arjuna, Guggulu, and Pushkaramula can be taken. And skin diseases, most of the geriatric people may be on the skin diseases. For that, Ballataka, Vidanga, Bakuji can be used. And Rasayana for overall health. If we are using the Guduchi, Amalaki, Ashwagandha, Gogrita, and Takra, definitely we are going to, if they are going to help in dealing the geriatric problems. And if at all asthma, it also one more problem of geriatric problem. There Shirisha, Agastya, Haridra, Haritagi will be useful. And arthritis, the common factor in old age. So there Rasona, Gugulu, Ashwagandha, Shunti as a secondary prevention. And neuropathies, Rasona, Gugulu, Bala, Ashwagandha will be useful. And now in diabetes is the most common in the old age factor. There Shilajitu, Amalaki, Haridra, Methika, all these things as a home remedies, as a medicine also can be used as secondary prevention. And lipid disorders, as we know, Gugulu, Haritaki, Pushkaramula. Hypertension, Rasona, Sarpagandha, Ashwagandha, Jatamamsi in the form of any tablet or kachai and etc. And tertiary prevention, they need psychological support and acharasayana. So they need most of the time a psychological support and love and affection from the kin and kith. Then only they will be psychologically healthy. So these are the general things. And we can say that generally to promote elderly free from any diseases, general health promotion by Rasayana, Naimitic Rasayana to prevent frequent illnesses, not to use tobacco, alcohol, physical activities, moderate exercises, participation in the social and community activities is very, very important. After 55 or 60 years, if they are isolated, definitely the psychological problems will occur. So participating in the social and community activities will be very helpful in health promotion. And living in a pollution-free atmosphere and yoga practices, including meditation also, will be useful in prevention of the lifestyle disorders in elderly. And significance Rasayana, as already speakers spoke, no need to speak much more because they have they spoke regarding the Rasayana. And you can say that aging is inevitable, that we know, and is unwanted by everyone, more so when it occurs early or prematurely. So when it occurs early or prematurely, people will suffer. Nobody wanted, but it's inevitable. That's why preventive principles of Ayurveda are capable to delay the aging process, as I told, primary and primary prevention, and helps in getting healthy aging by following the Dinacharya, Rucharya, Sadvrita, and Rucharya properly. So all these things will play a major role, and these are all acceptable and available, and there is no side effects and cost effective. This is my submission, sir. Thank you very much for giving this opportunity and sharing my views regarding healthy elderly life. Thank you, sir.
Thank you, Professor Reddy ji. Really, you poured total knowledge in a nutshell. And the idea is that you have given all these knowledge without any preparation and without any proper previous information. And in this way, you again proved that you are the best teacher of Swagath and Yoga subject. So in the same continuation, I remember that very day on 16th of August, when you have been ornamented the Best Teachers Award in our here, Pune. So all congratulations from IRES side, all our dignitaries, your well-wishers are always with you and sharing this achievement. This is our achievement and this is the achievement to a Swagath teacher. I use and I utilize today's movement in your presence that you have been well deserved given this award to you. Thank you, sir. Thank you so much. And again, thanks for your contribution to
Thank
our
you very much.
today's platform. Thank you. Thank you. And in the same discipline which I just started, now I would like to invite Dr. Nilakshi Dev Chaudhary as one male and one female ratio. So Dr. Nilakshi Dev Chaudhary, you are very much here, and I request Dr. Vishnu Prasad Sharma sir that you be ready for the next means address person, as you will not be left only just to invite and give the welcome address. Today you have to share the your viewpoint on our webinar. So Dr. Madam Nilakshi Dev Chaudhary, we are inviting you. Please come and give your viewpoint on today's webinars along with your suggestion. Thank you, ma'am. Namaskar.
Namaskar. Good evening, sir.
Good evening.
Good evening to all the participants, to all the eminent speakers. So today's webinar was really very good. There was a good discussion on geriatric care, and we got to know how to take care of our health of the senior citizens by Rasayan, by Ahar Vihar. So it was a detailed study, and we got to know what Ayurvedic drugs specifically we take care of each and every system. We have to spread it to the public, and public should know, and all our Ayurvedic BMS doctors should also be aware, and we should have more geriatric clinics or more geriatric camps in our area. And just like sir told, the Geriford is a very effective drug to maintain. Agnihotri sir told, Geriford drug is a very effective drug. We should utilize such drugs for premenopausal, postmenopausal ladies also. And we also have to advocate prayers daily for every senior citizen.
Yes.
We have to do to keep our mind happy. You'll have to do prayers. Happiness is one important factor. So that our neurotransmitters are secreted properly, so that there is no degeneration. We'll have to pray to God in the morning, in the evening, and chant mantras. Recitation of mantras is very important for the central nervous system, and also social work, walking, staying in touch with nature will also help us a lot, and maintaining the digestive tract, Agni enzyme level in the body, maintaining the kostas and maintaining the Agni, keeping the Agni in good condition is very important. And it was indeed a very good discussion. I'll end with these short words. Thank you, sir. Thank you for giving me the opportunity.
Thank you, ma'am. Thank you. So kind of you. Apart from our all suggestions and the points you raised, as mentioned by the earlier speakers regarding the Achar Sign 7 and other things, a very, very important point which you raised, that is the prayer for happiness. But I caught the point, the prayer for happiness, and you see the same discipline this society follows on daily basis. Our Pawan Sharmaji starts our webinar along with the prayer of Lord Shiva, Lord Saraswati, Lord Durga ji, our Bhagwan Vishnu, and along with our Dhanvantri ji. So really it is a part and parcel of each living being, irrespective of belonging of his and her religion. Prayer by folding hands before putting your feet on earth at the time of leaving the bed itself, it should be started, it should be observed, and we do like this. So this point is double, triple underlined, and we are all of that opinion that prayer makes everybody happy and healthy. And not only this, government of God, they also consider that these are my kids and they are remembering me without any demand, without any crisis and problem time. So the problems and crises should not be there in their life. They consider like this. So thank you very much. Thank you, ma'am.
Thank you, sir.
Thank you, ma'am. Thank you. So now I, with all my full respect, I would like to invite Professor Vishnu Sharma, our ex-principal of Government Ayurvedic College, Guwahati, Assam, to throw light on today's webinar's topic, along with some age-long experiences, so that we would be in position to get that knowledge. Thank you, sir. Professor Vishnu Sharma, sir. Namaskar.
Okay, namaskar.
Namaskar.
Yes, respected Agnihotri. Yes, today's webinar was most wonderful. Both the speaker, both the Parul A. Joshi and Dr. Baljot Kaur has presented their speech very nicely. Both the Parul directly gives stress on use of Rasayan drugs. Yes, it is most important. By using these Rasayan drugs or herbs, we can delay the aging process. These drugs can be used as a preventive aspect also and as a curative aspect also. So you see, dementia is a worldwide problem. If we use herbs as when dementia is started, then we get little bit result, but not too much. But these herbs, some of the herbs, this Medha herbs, there's a Brahmi, Sankhapuspi, like that. If we use before this retirement age, then we can prevent this disease, because dementia is a worldwide problem and there is no specific medicine, no specific treatment. So it is a problem for the family also, problem for the society also. Again, we have to give stress regarding herbs. For example, hypertension. People have to take medicine regularly. Yes, but one plant is available in our northeastern region. I did clinical trial also, experimental also. This Nefapu, Chlorodendraum, I forgot the exact name of this plant, but locally it is known as Nefapu. It shows wonderful result. And people of Nagaland, they consume this plant twice or thrice in a week. That is why on that area, these hypertension cases are less. Again, I will tell you regarding diabetes is a worldwide problem. In northeastern region, elephant apple, that is known in Assamese, Otenga, it has a anti-diabetic effect, anti-lipidic effect, and cardioprotective effect also. We did clinical trial, we did experimental trial, and we did antioxidant property also. Everything, antioxidant property is there. We did this research at Defense Research Laboratory, clinical trial also, and this experimental trial also. So this elephant apple can be consumed, people, as a preventive aspect also, and as a curative. If you have no diabetes, if you consume, no, it will give you strength to your body, and you protect your heart, and you will be free from the diabetes also. And so many herbs are there, yes, regarding Gurusi to increase the body immunity, because during the old days, immunity power has comes down. So Dr. Reddy has told already that Ashwagandha, Arjuna, Gurusi, if you consume daily, Ashwagandha powder 2 TSF twice daily, Arjuna Khirapak, then it will give strength to the heart, strength to the body. That message we have to circulate, not only in India, all over the world. Beauty is that if we have no disease also, if we consume, we can delay the aging process. For example, in case of liver disorder, yes, we have Phyllanthus neureri, Huya amlaki, yes, you can consume. Amla, it is available everywhere. We can give, we can prescribe, or people, yes, liver is okay also. At that time also they can consume to maintain health of the liver. And in as a people, most of the people, they have this respiratory problem, cough and this thing. So we ask the people, please consume more munakka, more basak, And if you have any bronchitis or asthmatic trouble, Albesia series, the research was done at BH also, and research at my department also. I did silico approach study also. Yes, because in northeastern region, respiratory disorder, asthma cases are more. By using this series, Tulsi, Basak, it shows very, very wonderful result. Because in case of bronchial asthma also, there is no specific treatment for any other pathies. Next, regarding this menopausal syndrome. Yes, rightly, Dr. Baljot Kaur has presented her talk very nicely, very nicely. She explained how and where people have to take the medicine regarding hot flush and this thing. So from my side, I would like to request, yes, all the people, please consume more Rosayan drugs. It will not give you any side effect. If you have no disease also, you can consume as a preventive aspect. If you have disease, some problem, yes, you can take as a curative also. Along with Dr. Nilakshi Dev Chaudhary has raised, yes, prayer. Prayer is most essential to come to reduce the stress, to reduce the stress. To reduce that. So that is why I would like to request all the doctors, please prescribe more Rosanian drugs, more herbal drugs to the people. So with these few words, I conclude my talk. Namaskar to everybody. Namaskar.
Thank you, sir. Thank you, Professor Vishnu Shah Sharma ji. As I was expecting, you fulfilled our desire, and you are also a part of parcel of the society. As we desired that you have got a long experience of dealing with all these cases, along with so many medicines, you shared your experience. And really, whatever the points you raised, especially as far as the Rachayan is concerned, Ashwagandha use concerned, Shankpushpi are concerned, they are very much still useful to go for an elderly person. And now I have got some confusion, because in our team itself, Miss Momita ji and Preeti Banerjee, both ladies are there. As per turn, now their number is due. And since Professor C.V. Jha Sir Guruji is there, he is not only having 40-45 years experience, teaching experience, and experience of age itself that leads amount in a form of say so many patients and their complaints, their remedies, their reactions, suggestions. And at the same time, though we are all almost past the 60 years, but he is a senior citizen also above us. So with due respect, I would like to invite and interested to get some Ashirvachan from Professor C.V. Jha sir. Guruji pranam. थोड़ा सा बताइए हम लोगों को. जी सर प्रणाम.
तो सभी लोगों को नमस्कार.
जी सर.
और मैं थोड़ा देर से जरूर जुड़ा.
जी 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 जी.
हाँ, अच्छा जो सारे हमारे सामने प्रेजेंटेशन हुए, दे आर वेरी नाइस, इंफॉर्मेटिव. और मेरी ओर से भी सुधाकर रेड्डी जी को पहले मैं बधाई दूंगा फॉर रिसीविंग बेस्ट टीचर अवार्ड.
थैंक यू सर. थैंक यू वेरी मच.
कि जो आज का सब्जेक्ट है जेरियाट्रिक, हाउ टू प्रिवेंट द जेरियाट्रिक, वृद्धावस्था को कैसे हम प्रिवेंट करें. तो जैसे जो भी लोग हमारे सामने आ रहे हैं, विष्णु को भी मैं देख रहा हूँ. पता नहीं अपना चेहरा तो मैं नहीं देख पा रहा हूँ, लेकिन सामने जो चेहरा आ रहा है तो सब पर वृद्धावस्था के पूरे लक्षण.
डोवा जी ने भी इसीलिए वीडियो ऑन कर लिया, भैया देख लिया, विजुअलाइज वी आर ऑल 65 प्लस लाइक दैट.
मैं करीब 75 को टच कर रहा हूँ.
66 मेरा भी हो गया.
तो वैसी स्थिति में कि वृद्धावस्था तो भाई स्वाभाविक स्थिति है. रहा कि हाउ टू प्रिवेंट द ओल्ड एज, क्या मतलब जो सेनेलिटी कहें इसको, तो दो चीजें हैं जो सारी बातें चर्चा में आ रही हैं। एक तो डिजीज कंडीशन है। अभी जैसे विष्णु प्रसाद जी ने बहुत सारी दवाओं के बारे में बताया, डायबिटीज का, हाइपरटेंशन का और ये सब, मेमोरी लॉस, डिमेंशिया, इन सब की। तो वास्तव में एक डिजीज का कंडीशन है और डिजीज फ्री कंडीशन है। डिजीज फ्री कंडीशन में जब भी whenever we will use any such medicines which are effective for the prevention of the aging process, certainly that will be give a better result. Whenever we will be in diseased condition, and then if we want to achieve to prevent the aging process, so disease is itself great cause for the aging process. बीमार अगर हुए तो पता चला कि ठीक ठाक हैं और 10 दिन में पूरा वृद्धावस्था का लक्षण चेहरे पर झलकने लगता है। तो सबसे कि फिजिकली, मेंटली, whenever we will be in healthy condition, that is the best condition to prevent the aging process. और जहाँ तक मेरा मानना है कि प्रसन्न रहना, और प्रसन्न तो तभी रहेगा कि पहली जो प्रसन्न रहने से पूर्व की चीजें हैं जो स्वास्थ्य की परिभाषा में हम लोग कहते सुनते चले आ रहे हैं, तो प्रसन्नात्मेंद्रिय मना जो क्या कहते हैं लास्ट का पार्ट है कि फिजिकल सारी चीजें हमारी नॉर्मल हों, तभी जाकर के फिर प्रसन्नात्मेंद्रिय मन की स्थिति अचीव हो सकती है। तो जब इस स्थिति में हम रहेंगे तो दैट विल बी द बेस्ट, क्या कहते हैं, बेस्ट कंडीशन टू प्रिवेंट द एजिंग प्रोसेस। और वनस्पतियों के साथ साथ जैसे एक उदाहरण कहीं पर सुनने में आया कि अर्थो ही यौवनम पुंसाम तद्भावस्य वार्धकम। क्या अर्थो ही यौवनम पुंसाम तद्भावस्य वार्धकम। दूसरी ओर जैसे कहा कि हम रसशास्त्र के आदमी हैं, तो इन अवर रस लिटरेचर देयर इज ए श्लोक मेंशन्ड बाय द भट्ट इन रसरत्न समुच्चय, अभ्यास योगा दृढ़देह सिद्धि कुर्वन्ति रुग जन्म जरा विनाशम। This way mentioned about the use of metallic bhasmas. मृतानि लोहानि रसि भवन्ति निघ्नन्ति रोगान् परिशीलितानि अभ्यास योगा दृढ़देह सिद्धि कुर्वन्ति रुग जन्म जरा विनाशम। ऑनसेट ऑफ डिजीजेस, रुग जन्म, रोगों के उत्पन्न होने की प्रक्रिया, तो प्रिवेंट दी रुग जन्म और प्रिवेंट दी एजिंग प्रोसेस, क्या वृद्धावस्था, रुग जन्म जरा विनाशम। तो ये मतलब वनस्पतियों का तो है ही है, आंवले के बारे में और शंखपुष्पी, ब्राह्मी, ये सारे के सारे जो भी रसायन ड्रग हैं, दे आर सर्टनली, अगर हम डिजीज फ्री हैं तो वी कैन अचीव बेटर इफेक्ट ऑफ दैट मेडिसिन। लेकिन अगर हम रसौषधियों पर जाते हैं, और रसौषधियों में भी जो खास करके स्वर्ण, रजत, माक्षिक, अभ्रक, इन सब से, शिलाजीत, इन सब से बने हुए जो कोई भी प्रिपरेशंस हैं, तो सर्टेनली दे विल बी मोर एंड मोर इफेक्टिव टू प्रिवेंट द एजिंग प्रोसेस। और बाकी प्रसन्न रहें और शरीर और मन से, और जैसे प्रसन्नात्मेंद्रिय मना, तो ऐसी स्थिति अगर हम बना के रखें, तो इसको बनाने के लिए जो सद्व्रत की बातें कही गई है वो सब, और जो स्वस्थ रहने के लिए जो क्या हमें करना चाहिए, बाघभट्ट के जो निर्देश हैं कि नरोहिताहार विहार से भी समीक्षिकारी विशेष सकता, दाता समा सत्य पर क्षमावान, आप्तोप से भी भवत्य रोगा। तो ये सारे जो मतलब उपदेश हैं, इन सब का हम अगर पालन करेंगे तो देन वी कैन अचीव द गोल टू प्रिवेंट द एजिंग प्रोसेस। तो ये है, बाकी बहुत सारे द्रव्य हैं, बहुत सारी चीजें हैं, लेकिन वही है कि अल्टीमेटली हम रोग मुक्त हों और उसके बाद जो भी प्रसन्नता के फैक्टर्स हैं उन सबको कैसे अचीव करें, इसमें हम जुटे रहें तो शायद हाँ वृद्धावस्था को हम, अदरवाइज वृद्धावस्था तो भाई आप कितना भी प्रयत्न करेंगे तो वो समय से जो होना है वो तो होना है, और वही है कि थोड़ा सा उसको प्रोलॉन्ग हम कर सकते हैं। अदरवाइज भाई रसशास्त्र का इतिहास अगर आप लोगों ने पढ़ा होगा तो नागार्जुन के बारे में कहा जाता है हाँ कि वो जिस राजा का मंत्री था उस राजा का क्या 40वां 50वां पीढ़ी या 20वां पीढ़ी क्या मतलब राजगद्दी नहीं अचीव कर पाया था। क्यों? कि नागार्जुन अपने उस राजा को रसायन द्रव्यों के सेवन से उसको बिल्कुल युवा बनाए हुए था, और उस युवा होने के चलते वो वृद्ध नहीं होगा तो गद्दी क्यों छोड़ेगा। तो जितने राजकुमार होते थे वो सब वृद्ध होकर के और स्वर्ग सिधार जाते थे और राजा अपनी गद्दी पर बरकरार है। तो ये सब कहानियां सुनने को मिलती हैं, और ये सारी चीजें जो हैं वो सब हमारे जितने भी रसायन द्रव्य हैं वनस्पतियों से लेकर के और जो मिनरल्स ओरिजिन के सारे हैं। रस द्रव्य तो सारे रसायन हैं, रस द्रव्य जितने भी हैं उसमें रेयरली ही खोजेंगे तो रसायन प्रॉपर्टी वाले शायद ना हो, अदरवाइज जितने भी हैं सब के सब, चाहे नागभंग ये सब लौह ताम्र ये सब हो, अभ्रक हो, माक्षिक हो, वैक्रांत हो, जितने द्रव्य हैं रस द्रव्य सारे के सारे रसायन प्रॉपर्टी वाले हैं। तो ये सारे मिनरल्स और इसके साथ साथ प्लांट, इन दोनों से सहयोग से और साथ साथ सद्वृत्त के पालन करते हुए हम क्या कहते हैं एजिंग प्रोसेस को प्रिवेंट कर सकते हैं। बाकी जो सारे के सारे नियम अभी हमारे रेड्डी साहब ने बताया ही और भी लोगों ने बताया, तो वही मतलब अल्टीमेटली इसके अलावा और कोई मतलब रास्ता नहीं है कि हम एजिंग को प्रिवेंट कर सकें। तो इन्हीं शब्दों के साथ मुझे मौका दिया आपने, तो बहुत बहुत धन्यवाद।
बहुत बहुत आभार सर, बहुत बहुत आभार गुरुजी, बहुत बहुत आभार। हमारी मनी यही इच्छा थी कि आज आपके भी विचार लें, और विशेष रूप से आप हम सब लोग ही उसी अवस्था से गुजर रहे हैं यहाँ पर कि और अधिक सावधानी लेने की जरूरत है, और अपने द्वारा कमाए
में एक प्रचलित है कि गई जवानी फिर नहीं लौटे, कितनों घी मलिदा खाए, ऐसा करके है। कितना भी घी मक्खन और कुछ भी खाएं वो समय के साथ, और दो ही चीज कहा कि मेहमान है, एक पैसा और दूसरा जवानी। क्या युवावस्था जो है वो कहा गया है कि 4 दिन, और उसके बाद तो फिर परिहानी काल शुरू हो जाता है और आदमी लुढ़कना शुरू करता है और महसूस होता है। जो जब 60 के ऊपर आप चलने लगेंगे तो हम कैसे डाउनवर्ड जा रहे हैं ये आप रोज अनुभव करेंगे, रोज यू विल फील। और ये सब स्वाभाविक प्रक्रिया है, उसमें वही है कि आप पहले तो स्वस्थ रहें, प्रसन्न रहें, तो शायद हो सकता है कि ये जो तेज लुढ़कने वाली प्रक्रिया है उसको आप कम अनुभव करेंगे। तो
जी बोलिए।
हाँ, मेरी ओर से विचार है और आगे चलें, कंक्लूड करें।
गुरुजी बहुत बहुत आपका बहुत बहुत आभार, बहुत शुक्रिया। आपने बहुत बड़ी बात कही, और जो वही यथार्थ है कि हमें प्रसन्न रहने का अधिक से अधिक प्रयास करना चाहिए, क्योंकि सबसे बड़ी चीज है कि ये कहीं से भी खरीदी नहीं जा सकती। और दूसरा आपने जो बात रखी कि अर्थोप यौवनम पुंसाम, कि यौवनावस्था बनाए रखने के लिए जो अर्थ है बहुत जरूरी है, लेकिन फिर भी किसी के पास बहुत ज्यादा अर्थ हो तो भी वो यौवनावस्था को रोके नहीं रख सकता है। और वृद्धावस्था में जब आप
नागार्जुन ने शुरू में ही कहा क्या अरे क्या कहते हैं वो दरिद्रता को उसने सबसे बड़ी व्याधि माना, बहुत
बड़ी व्याधि, बिल्कुल दरिद्र।
निर्दारिद्र्य इदम जगत,
तुलसीदास जी ने भी यही कहा, तुलसीदास जी ने यही कहा कि दरिद्रता ही सबसे बड़ा संकट है, सबसे बड़ा शोक का कारण है।
हमारे पास धन है तो इसलिए कहा कि अर्थो ही यौवनम पुंसाम, आपको आपके पास पर्याप्त संपत्ति है, धन है, तो आप युवा हैं, और उसके अभाव में वृद्ध। हाँ, ये एक हमारे पुराने ग्रंथ का
जी।
तो बड़ा हाँ सटीक है ये।
नहीं, अब आप ये देखिए कि अब हम हैं, आप सब लोग हैं, सबसे मजेदार बात ये सब लोग अपने अगर पेंशन संपन्न है तो अर्थापन्न है, अर्थ से विपन्नता नहीं है, हम लोग अर्थ संपन्न है, लेकिन बावजूद अवस्था जन्य तो विकास हो ही रहा है, तो उसमें स्थिति ये बन जाती है कि ज्यादा कुछ खा नहीं सकते, चाहे मीठा है, चाहे नमक है, चाहे तली हुई चीजें हैं, तो वही हुई ना कि अब तो अपने
जैसे आज हम लोगों की क्या पोजीशन है,
जी
हाँ, दांत है, आंख
जी
है, जांघ है, हाँ, ये सब
इंडिया
बोलता है एकदम क्या
इंडिया शिथिल हो रही है।
तो शिथिलता।
चलिए सर, बहुत आप लोगों के आशीर्वाद से सब लोग स्वस्थ रहे, प्रसन्न रहे। अब हमारे पास चूंकि हमारे दोनों ही गेस्ट स्पीकर्स आज उपलब्ध है, सर गुरुजी प्रणाम, आपका बहुत बहुत आपका आभार। तो दोनों ही हमारे गेस्ट स्पीकर्स उपलब्ध हैं और हम चाहेंगे कि हमें उनका फीडबैक मिले, लेकिन उससे पहले हम अपने वैद्यराजन पटंकर जी को बुलाना चाहेंगे। पीछे वो अभी ज्वाइन कर रहे थे, लेकिन इस समय हम नहीं देख पा रहे स्टेज पर। तो वैद्यराजन पटंकर जी, मुंबई से आपका स्वागत है। आप आज के विषय में कुछ चर्चा करें। और इस बीच हम डॉक्टर सीपी शर्मा जी हमारे अभी भी जुड़े हैं। अब मुझे ये नहीं पता उन्होंने आज हमारा ये वेबिनार सुन पाए या नहीं। अगर अल्पतम शब्दों में वो भी अपने कुछ आशीर्वचन दे दें तो हम अपनी फिर आज दोनों गेस्ट स्पीकर्स को उनके फीडबैक के लिए, क्योंकि जो डिस्कशन उन्होंने अभी सुने हैं उसके बाद ओपन डिस्कशन में, तो उनका हम कुछ थोड़ा 2 मिनट का सजेशन चाहेंगे। तो डॉक्टर सीपी शर्मा साहब, आप अपने विचार रखिए, थोड़ा स्वागत है आपका। डॉक्टर सीपी शर्मा जी। डॉक्टर सीपी शर्मा जी, आप हमारी आवाज सुन पा रहे हैं? इस बीच जब तक वो व्यवस्थित हो रहे हैं जुड़ने के लिए, मैं रिवर्स क्रम में पहले मैं चाहूंगा हमारी मैडम बलजोत जी वो अपने अभी के कुछ फीडबैक पर 2 मिनट की चर्चा दें, फिर हम वैद्य पारुल जोशी जी को इनवाइट कर लेते हैं। इस बीच हमारे डिस्कशन में डोमा साहब रह जाते हैं वो, और अगर सीपी शर्मा जी जुड़ेंगे तो हम दोनों लोगों के भी आशीर्वचन लेने का हमारा इच्छा है। तो मैडम बलजोत जी, आप कुछ और एड ऑन करना चाहेंगे अपनी चर्चा में?
सर, ये बहुत अच्छी डिस्कशन थी और बहुत अच्छा सबने प्रैक्टिकल पॉइंट्स बताए हैं। रसायन को हमने कैसे यूज करना है, और यही जो रसायन चिकित्सा है, यही फीमेल्स में भी बहुत अच्छा काम करती है। और जैसे हमने बोला ही है कि एजिंग प्रोसेस है, जरावस्था है, वो सब में आनी ही है। तो स्पेशली फीमेल्स में मैं जैसे मैंने एक पॉइंट रखा था कि उसमें रजस्वला परिचर्या, गर्भिणी परिचर्या और सूतिका परिचर्या, ये तीनों जो फेजेस हैं वो बहुत इम्पोर्टेंट हैं। और जब इन तीनों में बहुत अच्छे से ध्यान रखा जाता है तो हेल्थ अच्छे से मेंटेन रहती है। एंड स्पेशली हमने जब सूतिका परिचर्या में हम देखते हैं आफ्टर डिलीवरी हमको सिस्टोसील, रेक्टोसील देखने को मिलता है। तो वो इनिशियली इतना क्योंकि मसल्स उस टाइम पे स्ट्रांग होती हैं तो वो उतना फील नहीं होता है। और जैसे जैसे वो मेनोपॉज की तरफ आती हैं तो वो जो अर्ज इनकॉन्टिनेंस है, स्ट्रेस इनकॉन्टिनेंस है यूरिन का, तो वो जो है सिस्टोसील, रेक्टोसील की वजह से हमको ज्यादा देखने को मिलता है। तो जब डिलीवरी के टाइम पे सूतिका परिचर्या पे हम लोग अभी बहुत लोग ना मॉडर्न के अकॉर्डिंगली भी ठीक है, 1 हफ्ता 10 दिन रेस्ट कर लिया, बहुत हो गया, बाकी आप आपका नॉर्मल रूटीन रखिए, वो नहीं होना चाहिए। जो 40 डेज का सूतिका परिचर्या बताया है उसका बहुत सिग्निफिकेंस है और वो लॉन्ग टर्म में बहुत हेल्प करता है। और तो इसीलिए ये परिचर्या जो है इस पे हमको बहुत फोकस करना चाहिए। एंड मेनली फीमेल्स में जो डाइट है और जो उनका अपना रूटीन है वो उनको अच्छे से फॉलो करना चाहिए।
आवाज नहीं आ रही है
सर, सॉरी।
हाँ जी सर।
जी जी एक मिनट सर, मैम आपने जो सजेशंस दिए हैं वो मैंने नोट किए। आपके सजेशंस के बीच में एक हमारे दिमाग में बात आई है कि जो आपने चर्चा की कि सिस्टोसील और रेक्टोसील की स्थिति बन जाती है, तो उसमें आयुर्वेद के अनुसार कुछ स्थिति बताई गई है।
हाँ जी सर, उसमें अंडली योनि व्यापद, प्रशंसनीय योनि व्यापद, महायोनि बताई हुई है।
अच्छा अच्छा।
हाँ जी सर।
नहीं तो ये स्थिति मैंने मेनोपॉज के बाद या मतलब एल्डरली स्टेज में ही आनी है या सिजेरियन सेक्शन के बाद भी बन सकती हैं?
सर सिजेरियन सेक्शन के बाद में कम रहती है, पर जो नॉर्मल
अच्छा।
डिलीवरी है उस टाइम पे
जी।
अगर हमने उसको डिलीवरी को प्रॉपर हैंडल नहीं करते हैं तब कई बार
जी।
ये सिचुएशन बन जाती है।
मैंने
और
इसीलिए आपको
कभी
आप इस फील्ड के हैं, तुमने कहा आपसे ये बात बिल्कुल क्लियर कर रहे हैं। जी बताइए।
हाँ जी, और सूतिका के काल में भी जब वो रेस्ट नहीं करती हैं तो उस टाइम पे वैसे ही वात का प्रकोप होता है,
जी
मसल्स और लिगामेंट्स वैसे ही, तो उसमें लैक्सिटी रहती ही है।
बिल्कुल।
तो
जी जी।
उनको अपने वापस अपने फॉर्म में आने के लिए, ठीक है, वो 40 डेज का रेस्ट बताया है, बट इट टेक्स अप्रोक्सीमेटली मिनिमम ऑफ 6 मंथ्स। तो
जी
उतना केयर रखना जरूरी है। तो ये है उस टाइम पे धातुएं सब सम है और बढ़िया है, तो उतना फी उस टाइम पे महसूस नहीं होता है। जैसे जैसे वो धातु क्षय की अवस्था आती है तो इस एज में आकर के प्रोसिडेंट या भी वो हमको
जी
देखने को मिलता है, और उस टाइम पे हम
जी
उसका ट्रीटमेंट इतना नहीं हो पाता है।
जी जी। मैम वो आपने बताया ना जो 40 डेज का जो नॉर्मल चल जाता है, उसमें भी जो इसको हम लोग बोलते हैं नॉर्मल पिक्वेरियम के लिए,
हाँ जी।
अथवा उसमें भी अगर केयर आपने ना प्रॉपर रेस्ट न मिल पाया तो वो प्रसूतक जड़ टाइप इस तरीके की डेवलपमेंट भी होने लगते हैं। तो वो तो खैर बहुत ही जरूरी है। अथवा वो लोग जो ठंडा पानी पीने लगते हैं
हाँ
या
जी,
जो अपना दशमूल का काढ़ा का नहीं इस्तेमाल करते
करते
हैं,
हैं।
है ना,
यस सर।
या बना बनाया प्रमाथी वगैरह ले लेते हैं, तो उसमें भी उतना अच्छा रिजल्ट नहीं मिलता है। तो वहीं से शुरुआत हो जाती है।
हाँ
और
जी सर।
अगर अगर इनडिस्क्रिमिनेटली कोई परहेज न किया, सामान्य भोजन और चावल और ये सब खाना शुरू कर दिया, फिर वो उनको जो कटी बात की स्थिति बनती है वो समझिए
वो
कि
लाइफ
कर्ज
लॉन्ग
हो
रहती
जाता
है
है।
सर।
बिल्कुल कर्ज हो जाता है लाइफ के 10 साल 15 साल जो भी। इवन शायद सेकंड इशू अगर बोले तो बन जाए तो अलग बात है, नहीं तो बहुत टफ टाइम होता है उन लोगों के लिए। आप जरूर गाइड लाइंस देने के लिए कुछ बताना चाहेंगे कि हम नॉर्मल फर्स्ट डिलीवरी नॉर्मल हो या सीजर से हो, उसके बाद क्या कुछ ऐसा प्रिकॉशनरी पैकेज आप दें जिससे कि हमारी जो 50% पॉपुलेशन जो है वो उससे थोड़ा सा लाभान्वित हो सके।
सर जो एटलीस्ट जो फर्स्ट 10 डेज और कोशिश हो तो 40 डेज ही पानी गर्म लेने पिए, ठंडा तो बिल्कुल नहीं लेना है।
जी
फिर जो खाना है, जो आहार है वो जो उसमें जैसे बिल्कुल लघु और उसमें सुपाच्य होना चाहिए, जैसे मेनली मूंग की दाल यूज करते हैं। और
जी जी
साथ में ही उसमें स्तन्य भी अच्छा बने उसके लिए जैसे मखाना है,
जी
अपना नारियल है, खजूर है, छुआरा है, ये सब हम
जी
दूध में उबाल करके देते हैं। और वो भी
जी
आफ्टर 5 to 7 डेज के बाद में, जब अग्नि प्रदीप होनी शुरू हो जाती है उसके
जी।
बाद में फिर।
मैम उसमें उसमें शुंठी और जीरा वाला का भी जो उपयोग है उसका,
हाँ जी, हाँ जी
वो
सर।
शुंठी पानी विशेष रूप से जीरे का या हल्दी का, ये
जी
चीजें
सर,
लोग अभी फैशन में आके बिल्कुल नहीं, न तो
लेते हैं।
यूज करते हैं, न कोई बताने वाला रह गया है। और आयुर्वेदिक चिकित्सालय जब तक कंसल्ट नहीं करें तो मॉडर्न साइड से कोई बताएगा नहीं। तो मैं चाहता हूँ ये अपना इंटरनेशनल प्लेटफॉर्म है, इसको थोड़ा आप थोड़ा इम्फेटिकली ज्यादा दबाव दे के जरूर इसको क्लियर बता दीजिए,
सर
जिससे
जो,
कि
हाँ जी सर,
जी
जो पानी भी लेना है वो नॉर्मल प्लेन पानी नहीं लेना है। और
जी
उसको भी अगर लेना है तो जो चतुर्थांश हम उसको उबाल करके पानी जो यूज करते हैं वो थोड़ा लें, और साथ में
जी
सौंफ, धनिया और जीरा और थोड़ी अजवाइन, इसके
जी
साथ में पानी को बॉईल करके रखें, और यही पानी जो है वो थोड़ा थोड़ा करके पीना है।
बिल्कुल जी
और साथ में जो थोड़ा उठना और बैठना है वो थोड़ा साइड लेकर के उठना है, डायरेक्ट सीधा नहीं उठना है। बेबी को भी फीड करवाना है तो आगे को नहीं झुकना है, बेबी को जैसे पिलो के ऊपर या कुछ नीचे रख के बेबी की हाइट, बेबी को थोड़ा ऊंचा रखना है। आपकी जो बैक है वो सीधी रहनी चाहिए और उसको पीछे सपोर्ट देना चाहिए। और क्योंकि ये मेनली जो स्पेशली न्यू मदर्स हैं उनको पता नहीं होता है, तो वो आगे को झुक के ब्रेस्ट फीड करवाती हैं, तो उसकी वजह से पूरा
जी
स्ट्रेन पीठ पे आता है और उनको लो बैक की कंप्लेंट
लोग
ड्यूरिंग
बहुत बहुत
पर्क्यूरेशन
कॉमन हो
रहती
जाता
है।
है। जी
हाँ जी, तो उसमें जो हमारा सूतिका में जो हम मेडिसिन देते हैं, जैसे त्रिफला गूगल है, गोक्षराधि गूगल है, प्रतापलंकेश्वर रस है, ये सब देना चाहिए। और इससे जो सूतिका वात हम जिसकी बात करते हैं वो उससे उसका अच्छा से शमन हो जाता है।
थैंक यू मैम, थैंक यू सो मच। आपने बहुत सारे सेक्टर्स कवर किए, आपने अपनी अप्रोच, अपना गेस्ट लेक्चर तो दिए ही, हम लोग की क्वेरी को भी आपने और क्लियर किया और पूरे प्लेटफॉर्म को इंटरनेशनली। आपका बहुत बहुत शुक्रिया। और आप जैसे एक्सपीरियंस्ड सीनियर पर्सन जो कि एक डिपार्टमेंट विशेष गानी को पूरा कवर करते हैं, तो आपने लिया। यद्यपि हम थोड़ा सा आपके आज के अपने टॉपिक से अब हट गए होंगे, लेकिन हम समझते हैं कि ये प्रसूता
जरूरी
के
है ये सब,
जरूरी है, प्रसूता के हित के, स्वास्थ्य के हित के लिए बहुत जरूरी है, क्योंकि वहीं से हमारा पूरा भारत का भविष्य, विश्व का भविष्य बनता है। बच्चे पैदा करके उनको पालना और अपना स्वास्थ्य सही रखना, ये अपने आयुर्वेद को तो विशेष रूप से है, ये स्वास्थ्य रखना। आपका बहुत बहुत शुक्रिया। आप आगे भी हम लोगों के प्लेटफॉर्म से जुड़े रहिए, और हम जब भी आपका हमें जरूरत होगी हम आपको जरूर बार बार कष्ट देते रहेंगे और अपने प्लेटफॉर्म से को आपसे लाभान्वित होते रहेंगे। थैंक यू मैम सो मच। अपना कॉन्टेक्ट नंबर, आईडी वगैरह दे दीजिए प्लेटफॉर्म में, चैट बॉक्स पे। थैंक यू सो मच अगेन। आई वुड लाइक टू हैव माय first guest speaker with all due respect, Madam Parul Joshi ji, and as per our expectations and as per her own presentation all the way, she is covering all the areas, but still to have some more information from her. Overall, after overall discussion, she remained throughout with us. So Madam Vaidya Parul Joshi ji, स्वागत है आपका। नमस्कार।
नमस्कार सर जी। डिस्कशन काफी रसप्रद रहा, प्राय सभी पॉइंट्स पे डिस्कशन हो गया, लेकिन इसमें जो बातें हो रही है उसमें इन्फेक्टिव डिसऑर्डर्स की बातें रह गई साहब। इन्फेक्टिव डिसऑर्डर्स जो है वो इतना खवाई गुनिया छोड़ देते हैं बॉडी में कि उसकी वजह से और ध्यान से बाहर रह जाता है। एक प्रश्न था कि 10 साल के बच्चे को थोड़ी ना सेल डिजनरेशन होगा, तो उसी का ये है कि जो ग्रह जुष्ट होते हैं आयुर्वेद में बताया गया है, उसके अंदर न्यूरोटिक डिजीजेस जो है वो न्यूरल ट्यूब जो है, अपनी नर्वस सिस्टम जो है, अपनी ब्रेन स्टेम जो है, सेंट्रल नर्वस सिस्टम है, वो सभी को डिस्टर्ब कर लेते हैं ग्रह, और जो है उसकी रह जाती है इफेक्ट, आजीवन रह जाती है और मरण के उन्मुख पे ले जाता है, यानी वैकल्यकर और मृत्युकर भी होते हैं। तो ये इन्फेक्शियस डिजीजेस जो है उसके ऊपर आयुर्वेद में काफी डीप में चर्चा की है, और उसी के ऊपर जोर देना जरूरी है ताकि ओल्ड एज में कोई दिक्कत खड़ी ना हो। मेरे पास ऐसे कॉम्प्लिकेटेड केसेस आते हैं, इनफर्टिलिटी की ट्रीटमेंट ली, बच्चा हो गया, बात वहां खत्म हो गई। इनफर्टिलिटी क्यों हुई ये कोई सोचता नहीं है, बस बच्चा हो गया ना, काम खत्म। फिर जो इनफर्टिलिटी का कॉज था पेरेंट्स में, वो बच्चे में आएगा ये कोई सोचता नहीं है। अब वो बच्चा जो है वो जिस तरह पा फिल्म थी अमिताभ बच्चन और उसके बेटे की, उस तरह के डिजीजेस आते हैं जिनमें अकाल वृद्धत्व देखने को मिलता है। और आज आप जो चर्चा की, सभी ने जो चर्चा की, उसमें एक बात रह गई, अकाल वृद्धत्व। जीरियाट्रिक्स जो है वो हम 60+ में बोलते हैं, लेकिन कोई ये नहीं सोचता कि 6 महीने के बच्चे को दोनों आंखों में मैच्योर कैटरेक्ट है, 6 महीने के बच्चे को, तो वो आगे चल के उसकी चक्षु इंद्रिय क्या काम करेगी। फिर हम देखते हैं कि युवा भी नहीं हुआ बच्चा, 10-12 साल का है, पूरे बाल है, सफेद है या जड़ चुके हैं, उसको सुनाई बराबर नहीं देता है, वो ढंग से चल नहीं पा रहा है, वो ढंग से दौड़ नहीं पा रहा है, वो वृद्ध नहीं है तो क्या है, वो छोटी छोटी बात में चिढ़ जाता है। बच्चा तो हंसता खिलता रहता है। जैसा साहब ने बताया, बहुत बढ़िया बताया कि हमारी जो स्वास्थ्य की व्याख्या है वो हर समय लागू होनी चाहिए और हमें भी उसका स्मरण करते रहना चाहिए। अभी 10-12 साल का बच्चा वृद्ध के पूरे लक्षण बता रहा है तो उसको क्या बोलेंगे हम। वो युवान कब होगा? वो जब भी हम मशीन के जरिए किसी को जिलाना नहीं चाहते हैं। जो भी मृत्यु आए, नॉर्मल आए और स्वस्थ आए, मृत्यु भी स्वस्थ हो सकती है। कि जिस तरह जरा व्याधि है वैसे मृत्यु भी स्वस्थ की अपेक्षा रखती है। जिस तरह जन्म स्वस्थ होना चाहिए वैसे मृत्यु भी स्वस्थ होना चाहिए।
बहुत सुंदर, बहुत सुंदर।
हमारी संस्कृति में तो ये बताया गया साहब कि जिस तरह हम माँ के उदर से जन्मे वैसे ही अपने आप को अग्नि में समर्पित करना है। हमको अपने आप को हव्य बनाना है, तो ही अपना अगला जन्म जो है वो निश्चित होगा। वरना यहाँ तो ओम नमः शिवाय करते बैठो और वहां पे आपने समर्पण नहीं किया अग्नि को, तो अगला भाव तो शिवाय थोड़ी बीच में बैठेंगे। आपने किया, आप भुगतो। तो ये बात भूल चुके हैं हम, इसकी वजह से काफी दिक्कतें खड़ी हुई है। मैं आजकल 2-3 जगह में बोलना हुआ तो मैं यही बात की चर्चा करती रही हूँ। हड़प्पा संस्कृति में भी टॉयलेट्स थे, कॉमन टॉयलेट्स थे, कॉमन स्नानागार थे, वहां पे सैनिटाइजेशन की जरूरत नहीं थी। आजकल क्यों हो रही है? यानी 2000 साल पहले जो बने उनकी ब्रिक्स पक्की थी और आज जो बने वो ब्रिक्स और जो टाइल्स है वो कच्ची है। नहीं, वो बात नहीं है। कच्चे हम है। उस वक्त मनुष्य जो था वो जो खाना है हजम होने के बाद ही खाना खाता था, इसलिए उसका मल मूत्र जो है वो स्वस्थ रहते थे। मल जो है वो स्वेद, पुरुष और मूत्र तीनों मल जो है उनका स्वस्थ होना बहुत जरूरी है स्वास्थ्य के लिए। वो मरणासन्न व्यक्ति का मल मूत्र भी स्वस्थ होना जरूरी है। ये अपने जैन धर्म में जो साधु साध्वी महाराज होते हैं वे इसका बहुत ख्याल रखते हैं। इसे हमें भी ध्यान में रखने की जरूरत अब खड़ी हुई है। हम भी यह सोचे और अनुकरण करें कि अपना मल मूत्र जो है वो इतना निराम होना चाहिए कि उसमें कोई और जीव पनप न सके। अगर मल मूत्र जो विसर्जित है उसमें कोई जीव पनप नहीं सकता तो अपने शरीर के अंदर कैसे कोई पनपेगा? तो फिर कोई रोग होगा ही नहीं। आमेन तेन संयुक्ता दोषा दूष्याश्च दूषिता सामा इति उपदिश्यन्ते ये च रोगास्तदुद्भवा। आजकल जो है वो सब यही व्याधि मिल रहे। तो कुछ भी जीरेटिक ट्रीटमेंट करेंगे तो उसका तो रिजल्ट नहीं मिलेगा। इसलिए ये बहुत जरूरी है कि हम निराम हो के फिर रसायन सेवन करें ताकि वो रसायन औषधि जो है वो रसायन औषधि निष्फल न हो। और मेरा तो जोर आज आचार रसायन पे ही है। आचार रसायन से बढ़िया कोई रसायन नहीं है। वो एक गुरुजी बोल भी गए कि वो जो है वो पालन करना बहुत जरूरी है, उसके बिना सब कुछ व्यर्थ है। और आज अगर हम उसका इम्प्लीमेंटेशन करने लगे तो ये टेररिज्म जो है उसकी वजह से आने वाली जो समस्याएं हैं, चोरी चकैती, ब्लैक मनी, ब्लैक मार्केटिंग, ये सब में से हम बाहर आ जाए और जो प्रॉमिसरी नोट्स है उसके बजाय हम अपने संस्कार को अपना धन समझे। तो ये मेरा थोड़ी एक प्रार्थना सा विनंती है कि जो भी सुने इतना थोड़ा अमल में लाए तो बहुत बढ़िया रहेगा। हमारा तो यही दायित्व है कि नई पीढ़ी को अपना राह दिखाए ताकि वहां जाके अपनी उम्र में आके जब वे भी सीनियर सिटीजन बन जाए तो संतोष के साथ बात कर सके कि हमने अपनी जवानी में ऐसे ऐसे काम किए हैं कि आज जब हम सीनियर सिटीजन है तो हम अपने जीवन पे गर्व महसूस करते हैं। तो आप भी ऐसा जिए कि आप जब सीनियर सिटीजन बने तो आप भी गर्व महसूस करें। ओम नमः शिवाय साहब।
ओम नमः शिवाय मैम, बहुत 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 आपका आभार, बहुत शुक्रिया। लगता ही है कि बस आपको सुनते रहें, सुनते चले जाएं। सच में आपने मेरे ख्याल से तो मानवोचित सोच से ऊपर जाके दिव्य ज्ञान दिया, दिव्य सोच दी। स्पेशली उस समय तो लगा ही यही कि आपने कहा कि हम, क्योंकि मैं भी मानता हूँ, हम सब लोग मानते हैं मृत्यु कोई व्याधि नहीं होती है, तो मृत्यु तो रोगग्रस्त होके प्राप्त हो या आवश्यक नहीं है। साथ में मृत्यु पर्यंत हमारे मल मूत्र और स्वेद विकार रहित रहें, इससे बड़ी तो दिव्य सोच हो ही नहीं सकती। और दूसरे आपने जो कहा कि हम बाल्यावस्था में अगर प्रौढ़ावस्था प्राप्त कर रहे हैं उसके लिए कौन जिम्मेदार है, एक। और दूसरी, अगर इनफर्टिलिटी के बाद में कोई चीज बच्चा हो भी गया तो दूसरी जनरेशन को इनफर्टिलिटी तो नहीं ट्रांसफर हो रही है, इसके बारे में कौन चिंतन करेगा। और आपने जो कैटरेक्ट की और दूसरी चीजें बताई, मेरी भी एक्सपीरियंस से याद आ रहा है, शायद 2 वर्ष की भी बच्ची नहीं हुई, उससे कम उम्र की रही थी। कोई भी हाइजीनिक या कंडीशन होता है, उसको बाकायदा कंप्लेंट के बाद ये डायग्नोस किया गया कि उसको व्हाइट डिस्चार्ज था, उसको श्वेत पदार्थ 2। हम लोग सोच नहीं सकते थे कि अभी तो उसका यूट्राइन और पूरा जेनाइटल डेवलपमेंटल क्या हो रहा हो, लेकिन था तो बाई डिफॉल्ट था। क्या था, क्या ट्रीटमेंट हुआ, आराम हुआ। कई बार
नॉर्मल सगर्भा माता ने अब ज्यादा कफकर पदार्थों का सेवन किया होता है तो ऐसा होना नॉर्मल है, नथिंग टू वरी। सिर्फ स्वच्छता बनाए रखनी होती है ताकि वहाँ पे फंगल इन्फेक्शन ना लगे।
आपकी उपस्थिति मैंने यही चीज जानने का, शेयर करने का मन किया कि मेरे को बिल्कुल ऑलमोस्ट नियर फैमिली मेंबर्स में ही था कि मतलब उसकी प्योजनी में, तो एकदम से ख्याल आया
नीम पत्र को बना के उससे धोने की, दिन में 4-5 बार धोने की आदत रखी।
अब तो 35 साल से ज्यादा टाइम पहले की बात है, ये बात है 81 की या उसकी थी, ऐसी कुछ थी, 81 या 82 की थी। बट मुझे स्ट्राइक कर गया कि ना अर्ली एज में भी कोई दूसरे वाले लक्षण हो जाते हैं। तो आपका बहुत बहुत आभार, बहुत शुक्रिया। और एज यूजुअल आप, यू आर ऑलवेज एज रेडी विद एनी टॉपिक, विद ऑल योर नॉलेजफुल अप्रोच। सो थैंक यू सो मच, बहुत बहुत आपका शुक्रिया। ओम नमः शिवाय। अब हमारे लकीली मुझे खुशी है कि हमारे वैद्य राजन पटंकर जी फिर जुड़ गए हैं, ये हमारा सौभाग्य है। और मैं बिना उनके कुछ वचन लिए मैं वंचित रह जाता। डॉक्टर सीपी शर्मा जी और वैद्य हमारे डॉक्टर डोमा जी तैयार है, क्योंकि आज संडे है, रविवार है और 8:35 हो गया है। हम चाहते हैं कि 8:45 तक हम पैकअप कर लें, क्योंकि सबको अपने और भी काम मने हैं। तो सबसे पहले वैद्य राजन पटंकर जी का आमंत्रण है, स्वागत है। आप अपने वचन दीजिए हमको, आशीर्वचन।
नमस्कार। नमस्कार। आशीर्वचन नहीं, जो मेरी जानकारी है।
आपको नहीं पता कि 20 साल से लेके और 80 साल तक सब लोग हमारे उससे जुड़े हुए हैं, तो कहीं आशीर्वचन होंगे, कहीं सहयोग वचन होंगे, कहीं प्रेम के वचन होंगे, सबको यथा योग्य स्वीकार है जी।
जरूर 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 जरूर। हाँ, कि आज का जो दिन है सीनियर सिटीजन्स डे, उसके लिए सब सीनियर्स को भी एक जानकारी रखनी चाहिए, क्योंकि आजकल नए लड़कों में जनरेशन गैप ये एक वर्ड कॉमनली यूज होता है। तो उसके लिए जब भी माँ बाप या कोई भी सीनियर अपने बच्चों को या कभी भी समझाता है तो वो कहता है कि नहीं, वो आपके जनरेशन में था, और ऐसा करके वो कभी भी टाल भी देते हैं और आपको कुछ आजकल का समझ में नहीं आता है, ऐसी भी बातें होती है। तो ये दोनों तरीके से होना चाहिए, क्योंकि ताली जो एक हाथ से नहीं बजती है, क्योंकि उनसे अपेक्षा भी ज्यादा नहीं रखनी चाहिए जूनियर से, और सीनियर्स की उपेक्षा भी नहीं करनी चाहिए। ये मेरे ख्याल से ज्यादा महत्व रखता है, अपेक्षा और उपेक्षा। तो सीनियर सिटीजन्स का जो लाइफ है आजकल जो भी देखा जाता है, क्योंकि ऐसा यंग जनरेशन समझती है कि हम कभी बूढ़े होंगे ही नहीं, और ये क्या हमको सिखा रहे। तो इसके लिए एक बात, आज एक सेमिनार हुआ हमारे कॉलेज में, तो उसमें वैद्य कमलेश शर्मा जी ने एक बहुत ही अच्छा सब्जेक्ट उसमें प्रेजेंट किया था कि व्यवहार रसायन, बहुत ही एक अलग सब्जेक्ट था। तो व्यवहार रसायन में, क्योंकि घर में भी व्यवहार मतलब एज अ रसायन, क्योंकि जब भी छोटा पोता या पोती जब भी दादा या दादी को आकर के आलिंगन देता है और उनसे ओठ चूमता है या ये करता है, तो भाई वो भी एक टाइप का रसायन ही है। तो ये बाकी रसायनों से भी ये जो रसायन है वो उतना ही इम्पोर्टेंट है। और हम वैद्यों के लिए जो भी आचरण करना चाहिए सीनियर होने के बाद, क्योंकि सिर्फ पैसा देख करके प्रैक्टिस नहीं करनी चाहिए, रुग्ण या रुग्ण सेवा मैं जिसे कहता हूँ, वो एक एज के बाद वो करनी ज्यादा जरूरी है, ऐसा मैं समझता हूँ। तो कुछ थोड़े से अलग विचार थे, पर वो मुझे रखने का मौका दिया, इसके लिए विष्णु शर्मा जी, अग्निहोत्री जी और दोनों भी स्पीकर्स का धन्यवाद देता हूँ। थैंक यू
सर। थैंक यू सर, बहुत बहुत धन्यवाद। नमस्कार, बहुत धन्यवाद। और विशेष रूप से आपके आज के सफल आयोजन के लिए जो आपके अपने कॉलेज में हुआ, उसके चित्र आपने हम लोगों के साथ में भागीदार दी, बहुत अच्छा लगा। वैद्य कमलेश जी अपना व्यवहार रसायन पर चर्चा किए, आप सब लोगों का बड़ा अच्छा हृदय से सम्मिलन हुआ, अच्छा लगा, बहुत बहुत बधाई आपको। अभी हम नोट पढ़ पा रहे हैं चैट बॉक्स में, हमारे डॉक्टर आदरणीय वैद्य डोमा जी कह रहे हैं कि वो जा रहे हैं, निकल रहे हैं। तो डॉक्टर सीपी शर्मा जी, अगर आप हमारी आवाज को सुन रहे हैं, आप जल्दी से 2 मिनट में अपनी कुछ आज के मंथन पर, चिंतन मंथन पर अपने भी प्रकाश दे दिए, तो ये पूर्णत्व को प्राप्त हो जाएगी हमारी वेबिनार आज की। जी सर।
जी सर,
नमस्कार
जी सर।
सर। हाँ, जय हो, जय हो, नमस्कार।
आज के सीनियर सिटीजन डे पर सभी को सादर अभिवादन करते हुए मैं केवल 2 ही बातें कहना चाहूंगा कि वृद्धावस्था निश्चित ही रचनात्मक क्रियात्मक परिवर्तन लाती है। रचनात्मक क्रियात्मक परिवर्तन के साथ साथ हमारा जो साइकोलॉजिकल, हमारा सोशल व्यवहार है, वो भी थोड़ा सा चेंज होता है। तो जहाँ साइकोलॉजिकल व्यवहार, यहाँ एक वैद्य का या एक सीनियर सिटीजन का एक कर्तव्य बन जाता है कि जराजन्य जो भी अवस्था है, उन अवस्थाओं में चाहे हम सदव्रत का पालन करें, आचार रसायन का पालन करें, या रसायन द्रव्यों का सेवन करें, या आहार का, जो आहार, जिस तरह का आहार हमें साथ में है, जो हमें आवश्यक है, जो ऋतुजन्य है, उस जो हमारी रसायन का काम करेगा, वो आहार शायद सभी वृद्धों ने चिन्हित कर रखे होंगे। कई बार क्या होता है, जैसे सर्दी जुकाम हो रहा है आजकल, ये वायरल वाला जो फीवर चल रहा है, वायरल वाला मौसम चल रहा है, इसमें हमारे यहाँ हमारे चाचा जी कृषि विभाग में असिस्टेंट डायरेक्टर से रिटायर हुए, तो जब भी उन्हें जुकाम होता था तो वो मूंगफली खाते थे। और दूसरा, वो लपटी आलू, इसकी गुड़ और आटे की, इसमें अदरक डाल करके एक पतला सा अवले टाइप का बना के लपटी और घी डाल के खाते थे। तो ये उनको साथ में था, और यदि मैं जुकाम में मूंगफली खाता हूँ तो मेरा जुकाम बढ़ जाता है। तो ऐसा कुछ अनुभव जन्य जो भी सीनियर सिटीजन के पास अनुभव है, उसको शेयर करें। और हम लोगों को स्पेशली जो व्याधियां होती हैं इस उम्र में, जैसे वातजन्य न्यूरोलॉजिकल डिसऑर्डर्स हैं, साइकोलॉजिकल है, तो चिंता, शोक, इन सबको अपन आहार से, धातु क्षयजन्य या कोई बूंद हो गया, उस बूंद का मैनेजमेंट कैसे करना है। तो ये एक स्पेशल स्टेटस में हमको तुरंत अविलंब रसायन औषधियां या व्याधि से संबंधित औषधि का सेवन करने का प्रावधान है। इसमें हमें यदि हमारा वृद्ध जो हमारे सर्किल में है उसको काउंसलिंग की जरूरत है, तो हमें उन्हें काउंसलिंग भी करना चाहिए। कई बार वो इतने चिड़चिड़े, इतना चिंता करते हैं कि उनको काउंसलिंग की जरूरत होती है, और नियमित आहार की और नियमित उनका दिनचर्या निर्धारित हो। ऐसा कुछ हल्का फुल्का अपन, चाहे हम पार्क में बैठ के उनको निर्देशित करें, या कहीं एक जगह बैठ करके बुजुर्ग लोग एक दूसरे से काउंसलिंग करें, जो सदव्रत का पालन हो सकता है। और अपनी अग्नि का ध्यान रखते हुए, कई बार क्या है हम लोग ज्यादा खा जाते हैं, अपनी अग्नि का ध्यान रखें, और आपकी एक्टिविटीज किस तरह की हैं, उन एक्टिविटीज के ध्यान रखते हुए, ऋतुजन्य फलों का सेवन करते हुए अपनी आयु को निश्चित व्याधि रहित जीवन यापन के लिए तैयार रखें। इन्हीं शब्दों के साथ धन्यवाद। हेलो।
बहुत बहुत शुक्रिया, बहुत बहुत शब्दों में और बहुत ही महत्वपूर्ण विचारों पर आपने बात रखी। और यह सत्य है कि दोनों ही चीजें हैं कि हमको क्या सुपाच्य है, क्या पाच्य नहीं है, कहाँ पर हमको अपने हरकतों में, आदतों में विराम लेना है, ये बहुत जरूरी हो जाता है। और यहीं पर अपनी आपकी बुद्धिमानी जो है जीवन को और साफ सुथरा आगे खींच बनाए रखने के लिए काम आती है। एक बात मुझे याद आ रही 2019 में और उससे शायद 1 साल पहले एक हमने लेख लिखा था कि वृद्धावस्था एक सौभाग्य है, और उसको हमने इस पॉइंट पर हाईलाइट किया था कि देखिए हम सब लोग जानते हैं, मेडिकल फ्रेटर्निटी से जुड़े हैं और दूसरे भी, कि कितने जन्म लेने वाले बालक ऐसे हैं जो अपना प्रथम वर्षगांठ, प्रथम हैप्पी बर्थडे नहीं मना पाते हैं। इसी क्रम से घटते 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 इन्फेक्शियस डिजीज, मेटाबॉलिक डिसऑर्डर्स या नॉन इन्फेक्शियस डिजीज से करते करते जो अकाल कवलित होते रहते हैं, तो 60 साल से ऊपर की जिनको अवस्था प्राप्त होती है, तो निश्चित रूप से उनके साथ में एक विषय तो रहता ही है कि उनका दिनचर्या, ऋतुचर्या और उनकी सात्मीयता इतनी अवश्य रहती होगी कि उन्होंने यहाँ तक अपने को व्याधिग्रस्त होके फिर ठीक होके, फिर व्याधिग्रस्त होके फिर ठीक हो गए, फिर उष्ण जलपान ग्रहण करके फिर भोजन पर विराम अंकुश लगा के किया होगा। तो हमारे ये बहुत ही सौभाग्य की बात है कि हमारे अपने परिवार के जन या और हमारे गुरुजन और हमारे श्रेष्ठ लोग कैसे बढ़े। जैसे हमारे जिया जी 48 साल पे चले गए, हमारे भाई साहब ऐसे 44-47 साल पहले वाले चले गए, पिताजी लोग 75 साल तक रहे और रोग रहे। और इससे मुझे याद आ रहा है अपने वैद्य प्रेम शंकर जो पांडे जी हैं, उनके पिताश्री जी 77 हैं प्रयागराज में। और ये हम लोगों के लिए, सबके लिए एक बहुत बड़ा संदेश और गौरव का विषय है कि कुछ भी सही, पुराने लोग अमृतलाल नागर हुआ करते थे और लोग हुआ करते थे, तो बड़े बड़े पत्रकार और लोग उनसे उनकी आत्मकथा के रूप में दिनचर्या व्यवस्था पूछने, पढ़ने, लिखने जाते थे कि वो अपना जीवन यापन कैसे कर रहे हैं। और वो कहते थे भैया हम कोलगेट नहीं लगाते हैं, हम ब्रश नहीं करते, हम दातुन का सेवन करते हैं, एंड समय पर सोते हैं, समय पर जागते हैं, सीमित भोजन करते हैं और ईश्वर आराधन करते हैं और परोपकार की भावना रखते हैं। अगर किसी के कार्य आ सकते हैं तो हम जरूर कार्य आते हैं, धन से, मन से, शरीर से, समय से। तो वो बड़ा प्रसन्न आत्मेंद्रिय वाली जो स्वास्थ्य की स्थिति है उसको दिलाती है। तो ये कुछ आज के विचारों, आज के वेबिनार का निचोड़ हो सकता है। अब चूंकि 9:15 बज गए, मैं प्लेटफॉर्म को, चूंकि डॉक्टर पवन शर्मा जी अन्यत्र व्यस्त हैं, मैं डॉक्टर अपने परीक्षित देवनाथ जी को प्लेटफॉर्म वापस करता हूं, जिससे वो आज के कार्यवाही को आगे के लिए पूर्ण विराम की तरफ ले चलें। डॉक्टर परीक्षित देवनाथ जी, नमस्कार। डॉक्टर परीक्षित देवनाथ जी, आप सुन पा रहे हैं? प्लेटफॉर्म में आज की कार्रवाइयां औपचारिक रूप से पूर्ण हो रही हैं, सभी का हम लोगों ने डिस्कशन पे भी करा लिया है। यस प्लीज जी।
हाँ
जी
सर, मैं थोड़ा बाहर निकला हुआ हूँ, गाड़ी में हूँ। अच्छा,
कोई बात नहीं। तो हम एक बार पुनः प्रोफेसर विष्णु प्रसाद जी से प्रार्थना करेंगे कि वो आज के वेबिनार को, अब वो आगे की प्रोसीडिंग्स को लेके और इसको समापन ले जाए। मैं अपने आज जो हमारे गेस्ट स्पीकर्स थे वो उनका धन्यवाद करते हैं और उनको बहुत बहुत उनके सराहना करते हैं उनके आज के वेबिनार में अपने विचार देने के लिए। और साथ साथ जो हमारे आज के जो हमारे आज डिग्निटरीज जुड़े हैं, उनका हम सिर्फ नामों कह के उनके प्रति अपना नमन और अभिनंदन करना चाहेंगे। प्रोफेसर बीपी शर्मा जी, डॉक्टर सीके कटियार जी, मिस प्रीति बनर्जी जी, प्रोफेसर अनूप कुमार गखड़ जी, डॉक्टर डोमा जगदीश्वर जी, डॉक्टर निशांत त्रिपाठी जी, प्रोफेसर पी सुधाकर रेड्डी जी, वैद्यराजन पटंकर जी, मिस मोमिता शर्मा जी, अविनाश ननवारिया जी, डॉक्टर रामानाथन जी, डॉक्टर परीक्षित देवनाथ जी, डॉक्टर पवन कुमार शर्मा जी और डॉक्टर नीलाक्षी देव चौधरी जी और डॉक्टर सीपी शर्मा जी, आप सब लोग आज हमारी। हाँ, मैं वैद्यराजन पटंकर जी अपना अमूल्य समय हम लोगों को देना चाहते हैं। स्वागत है आपका, स्वागत है, नमस्कार।
अभी ये साइड बाय साइड पवन जी का जो ये चालू है कनाडा इंडियन फाउंडेशन, तो उनका भी इतना एक्सलेंट रहा इंवास्टक चूर्ण के बारे में, तो मैं भी वो भी बीच बीच में देख रहा था।
मैं नहीं देख पा रहा हूँ जी, मैं नहीं देख पा रहा हूँ कि अभी इधर हम ये वाला संभाले हैं, सभी मैदान छोड़ जाएंगे तो कैसे गाड़ी आगे बढ़ेगी। क्योंकि ना हम इधर मेरा हरि वर्मा जी का परसों आया था ना कॉल, तो मैंने कहा फिर इधर हमारा समय हो जाता है 9, 9:30, 10, 11। चलिए, अच्छा किया आपने दोनों तरफ विजिट किया, स्वागत है। और पवन जी तो जहाँ जाएंगे पवन वेग से अपनी छाप छोड़ेंगे।
एकदम।
प्रोफेसर विष्णु प्रसाद जी, एक फॉर्मल क्लोजिंग कह दीजिए।
ठीक है, थैंक यू।
Thank
तो आज का जेरिएट्रिक केयर बाय आयुष बहुत बढ़िया वेबिनार था। All the eminent speaker, they have delivered their speech very nicely. I offer my sincere thanks to both Parul A, Joshi and Dr.
आवाज आपकी
वीडियो ऑफ करके आप बोल
हाँ नहीं 2 लाइन बोलना है, आगे आवाज आगे
आ गया ना? हाँ. So
जी,
I
आगे।
offer my sincere thanks to both Parul A, Joshi and Dr. Baljot Kaur for excellent deliberation of today's talk. And I offer my thanks to all the participants. So thank you to all. And now this webinar is ended. Namaskar.
Thank
Good night to everybody.
नमस्कार, शुभ रात्रि सभी को, शुभ रात्रि, नमस्कार सबको,
रात्रि।
अभिवादन सबको, नमस्कार,
शुभ रात्रि।
शुभ रात्रि, थैंक यू।